أصعب من يوم الأول. الأمس عشنا محاضرات، عشنا تصريحات، وعشنا خاصة بيان قرطاج، البيان الذي كتبناه وخرج من الأعماق، من الصحة، من البيئة، ومن الفلاحة، ومن عالم الحيوانات. بيان يجمع تونس بكامل البلدان المجاورة، يجمع تونس بالرؤية العالمية، بالتشارك مع المنظمات الذين هم اليوم سيساعدون بالاشتراك معا على تطبيق ما قمنا بصياغته بالأمس. اليوم نبدأ التطبيق. اليوم محاضرات، تجارب، تبادل خبرات، وركز بالأساس على ماذا سنفعل اليوم، كيف سنطبق مبدأ الصحة الواحدة. اليوم تشارك، تطبيق، يد في اليد. حضوركم اليوم في هذا المبنى اللائق، حضوركم رغم أن الجو حار، الجو ممتاز، حضوركم هنا يدل على أن الناس الكل يد في اليد مقتنعة بهذا المبدأ وسنقدمه إلى الأمام. سلسلة من المحاضرات، قامات عالمية اليوم تتكلم في هذا المنتدى، وهذه فرصة. واسمحوا لي مع الوزارات لأقدم شكر كبير الأستاذ هاشمي الوزير الذي ترأس كل النقاشات العلمية، وهو اليوم باش يحضر لنا كينوت مهم جدا، وهو باش يقوم بالفكرة إلى تحويل كل الرؤية اللي قمنا بها في تونس وأنحاء العالم من البحث العلمي إلى التطبيق الواقعي على أرض الواقع. شكرا لكم على الحضور، ويوم ثاني ناجح.
شكرا لكم دكتور بوسويتا. إذن ننطلق بعد كلمة الافتتاح مع أول حصة نقاش اللي بعدها باش تكون الكينوت مع الأستاذ هاشمي لوسير. يكون لي شرف تبادل النقاش معه من بعد، ولكن الآن نمر إلى أول حصة نقاش باش يكون موضوعها حول دور المنظمات الدولية في دعم الدول والمؤسسات على المستوى المحلي في دعم الصحة الواحدة. نطلب أن يلتحقوا بي. نبدأ بالدكتور محمد صالح بن عيسى باش يكون عنده تقديم كلمة في البداية، ثم نمر إلى نقاش تقني. الدكتور محمد صالح بن عيسى الأمين العام مساعد لجامعة الدول العربية، الكلمة ليك. صفقة عليه. مرحبا.
صباح الخير للجميع. بسم الله الرحمن الرحيم. معالي السيد وزير الصحة بالجمهورية التونسية الدكتور مصطفى الفرجاني، أصحاب المعالي والسعادة، السيدات والسادة الحضور الكريم، أتشرف بأن أنقل إلى حضراتكم اليوم تحيات معالي السيد أحمد أبو الغيث الأمين العام لجامعة الدول العربية، والتعبير عن تشكراته لتوجيه الدعوة الكريمة للجامعة العربية لحضور هذا المؤتمر الهام الذي تستضيفه الجمهورية التونسية، والتعبير عن تطلعه للتوصيات التي ستتمخض عنها أعمال هذا المؤتمر، والتي سترفع طبعاً إلى مجلس وزراء الصحة العرب في دورته القادمة لاعتمادها وللتنسيق مع وزارات الصحة بالدول العربية الأعضاء للعمل على تنفيذها. كما يسعدني أن أعبر طبعاً عن بالغ الشكر والتقدير للجمهورية التونسية حكومة وشعباً، وعلى رأسها وزارة الصحة، على تنظيم هذا المؤتمر الهام تحت عنوان الصحة الواحدة، الذي يشكل التزاماً واضحاً ومتيناً بمبدأ الترابط الوثيق بين صحة الإنسان وصحة الحيوان وسلامة البيئة. ويأتي هذا المؤتمر الهام في ظل تحديات صحية كثيرة تواجه النظم الصحية العربية، خاصة في ظل الأزمات الإنسانية والاجتماعية والاقتصادية التي تشهدها بعض الدول العربية الأعضاء. كما لم يعد خافيا على الجميع بأن ما يجري في غزة هو حرب إبادة وتطهير عرقي، إضافة إلى استهداف المنشآت الصحية والبيئية والطواقم الطبية، ومنع دخول الأدوية والمستلزمات الطبية والمساعدات الإنسانية الضرورية للحياة، واستمرار الحصار والتجويع في وضع هو الأسوأ منذ أكتوبر 23. كما لم تعد الكلمات ربما كافية لوصف هول المأساة الإنسانية في قطاع غزة وما يتعرض له الشعب الفلسطيني الشقيق من جرائم حرب. السيدات والسادة الحضور، إن مبدأ الصحة الواحدة يعد نهجاً متكاملاً وموحداً لمواجهة التحديات الصحية المعاصرة ولخلق نظم صحية مرنة وقادرة على الصمود أمام الطوارئ الصحية وتفشي الأمراض والأوبئة. كما يعد أمراً أساسياً لإحراز تقدم بشأن توقع الأمراض التي تنتشر بين الحيوان والبشر والوقاية منها واكتشافها ومكافحتها، ومعالجة مقاومة مضادات الميكروبات، وضمان سلامة الغذاء، ومنع التهديدات المتعلقة بصحة البشر والحيوان. وتماشياً مع المستجدات والأولويات الصحية لوزارات الصحة بالدول العربية الأعضاء، فقد اتفق معالي وزراء الصحة العرب في مارس 23 على اختيار محور الدورة العادية 60 لمجلس وزراء الصحة العرب ليكون مقاربة صحة واحدة ومقاومة مضادات الميكروبات بهدف تبادل الخبرات والتجارب والرؤى وتحديث البرامج وخطط العمل المشتركة في هذا الشأن، والموافقة على الاحتفال باليوم العربي للصحة بتاريخ 4 سبتمبر من كل عام، وهو ذكرى تأسيس مجلس وزراء الصحة العرب لعام 24 تحت شعار تعزيز نهج الصحة الواحدة بهدف تحقيق التوازن بين صحة الإنسان والحيوان، ومن أجل إنشاء طرق جديدة للترصد ومكافحة الأمراض وتفعيل نهج الصحة الواحدة على كل الأصعدة الوطنية والإقليمية والعالمية. كما أن جامعة الدول العربية ومن خلال مجلس وزراء الصحة العرب تعمل على تعزيز التعاون والتكامل العربي في مجال الصحة العامة، وتولي اهتماماً خاصاً بنهج الصحة الواحدة، وهي من الدروس المستفادة في مواجهة جائحة كورونا للتأكيد على أهمية التركيز على جميع المصادر التي تؤثر والعوامل التي تؤثر على انتشار الأمراض والأوبئة. وهذا طبعاً لابد من التذكير بالمقاربات الأخرى التي يولي مجلس وزراء الصحة العرب اهتماماً كبيراً بها، وهو موضوع مقاومة مضادات الميكروبات. وفي إطار الالتزام السياسي من قبل جامعة الدول العربية بأهمية موضوع مقاومة مضادات الميكروبات، تم إقرار مشاركة الدول الأعضاء في الأسبوع العالمي للتوعية بمقاومة مضادات الميكروبات بهدف تبادل الخبرات والتعاون لاتخاذ التدابير الوقائية اللازمة للحد من مقاومة هذه المضادات. ويعد هذا الأسبوع الذي يقام وتطور حالات العدوى والعدوى المقاومة للأدوية وانتشارها. كما كلفت القمة العربية في دورتها دورة 2024 كلفت الأمانة العامة لجامعة الدول العربية ومجلس وزراء الصحة العرب بدعم جهود المملكة العربية السعودية في الإعداد للمؤتمر الوزاري الرابع رفيع المستوى الذي انعقد في نوفمبر 24 بالمملكة العربية السعودية، استكمالاً لنتائج المؤتمر الوزاري الثالث رفيع المستوى الذي استضافته سلطنة عمان في نوفمبر 22 حول مقاومة مضادات الميكروبات، وتم اعتماد نتائجه من قبل مجلس وزراء الصحة العرب في دورته العادية 61 التي انعقدت في جمهورية العراق في ديسمبر 24. الحضور الكريم، يلتزم مجلس وزراء الصحة العرب عملاً بأحكام نظامه الأساسي على تمكين النظم الصحية وتعزيزها، كما يدعم الدول الأعضاء في بلورة سياسات صحية متناغمة ومتكاملة، وتعزيز القدرات الوطنية من خلال الدعم الفني والتدريب والقوانين الاسترشادية الكثيرة التي أقرها المجلس منذ إنشائه، وكذلك الاستراتيجيات التي اعتمدها بالتنسيق والشراكة مع منظمة الأمم المتحدة ومنظماتها المتخصصة ذات العلاقة. إن انعقاد مؤتمركم هذا في تونس يعكس أهمية بالغة واهتماماً متزايداً بضرورة توحيد الجهود، كما يؤكد على أهمية المضي قدماً بضرورة التركيز على الصحة في كافة المجالات والقطاعات، ومنها التعليم والزراعة والبيئة في إطار نهج الصحة الواحدة دائماً التي تمثل الحجر الأساس في تحقيق أهداف التنمية المستدامة وصولاً إلى الأمن الصحي العربي. كما تجدد جامعة الدول العربية التزامها الكامل بدعم هذه المبادرات الرائدة ودعم الدول العربية الأعضاء من خلال هذا النهج على تحسين نظمها الصحية وتعزيز الصحة المستدامة. الحضور الكريم، السيدات والسادة، تتطلع جامعة الدول العربية إلى خلق شراكات جديدة وتبادل الخبرات مع منظمة الصحة العالمية للبحث والتطوير في نهج الصحة الواحدة ومقاومة مضادات الميكروبات، بهدف استحداث علاجات لحالات العدوى المقاومة للأدوية التي تشكل أكبر خطر على الصحة، خاصة في الدول النامية، والاستفادة من النظام العالمي لترصد مقاومة مضادات الميكروبات واستعمالها بغرض مواصلة سد الثغرات المعرفية والعلمية وإثراء الاستراتيجيات المنتهجة على جميع المستويات، وتقديم الدعم التقني وتسهيل انضمام جميع الدول إلى هذا النظام. تؤكد الجامعة ختاماً على أهمية تضافر كافة الجهود واستمرار العمل العربي المشترك والمنسق في المجال الصحي وتوحيد الرؤى والأولويات والممارسات لبناء مستقبل صحي آمن لشعوب المنطقة. أجدد مرة أخرى تشكراتنا لوزارة الصحة في تونس وعلى رأسها معالي الدكتور مصطفى الفرجاني وزير الصحة بالجمهورية التونسية على هذه الدعوة الكريمة لجامعة الدول العربية، وطبعا متمنيا للجميع ولأعمالكم كل التوفيق والنجاح، والسلام عليكم ورحمة الله وبركاته.
شكرا لكم على هذه الكلمات. كان هذا ممكن نقول إطار سياسي للندوة الأولى، باش يكون نقاش تقني الآن مع الدكتورة يواندي عليمي، One Health Unit Lead of Africa CDC. Can you join us? Thank you. والدكتور فرانسوا اسميوت, Task Team Leader à l'AFD, donc l'Agence française de développement. Okay. So إذا باش يكون الحوار أسهل، ما عندوش ترجمة، إذا باش يكون باللغة الإنجليزية. So our discussion today will tackle a very important topic. We'll tackle the dimension of the One Health approach in our region and on a local basis, but also how to do it between countries. So how can international organizations meaningfully support national institutions without substituting them, and also to deliver locally anchored, resilient One Health systems, whether it's critical support, it's funding, diplomacy, or regional cooperation. The role today of international players, I think it's crucial, and it's also at the same time evolving. And it must evolve with national priorities at the center. So let me start, I'll probably start with you, Honor Rodin, but not only because of that. I think there's a very crucial question that we could start with. So Dr. Halimi, from your experience leading the One Health agenda at Africa CDC, what are the most impactful ways international organizations today can support local institutions in operationalizing One Health, and especially in fragile or resources constrained settings, without overshadowing national ownership, because that's important at the same time. I think everyone is aware of this, and they're probably okay with that.
Thank you. Thank you, and good morning, Excellencies. I bring you warm greetings on behalf of His Excellency Dr. John Kassir from Addis Ababa. I think over the past interaction, we can all agree that One
Sorry, I
Health-
could have started somewhere, talking about Addis Ababa. Is everyone familiar with Africa CDC? كل تعرفوا Africa CDC? Maybe we could introduce in a few seconds.
Yes,
what is
fantastic.
It?
That would be a great opportunity, ladies
Sometimes
and
I
gentlemen.
tend to jump in the topic,
Yes. Africa CDC is the African Union's foremost public health agency with a mandate to ensure that we have a safer and healthier Africa. And I'm quite pleased with the way this question has been generated. One of the things we continue to push at Africa CDC is that countries must be able to own and drive their own health agenda as well as priorities. We called for this during our experience in COVID-19. I'm sure you've heard of the new public health order, where we are calling for countries to be self-sufficient and resilient to be able to address some of these health security issues. One Health is quite complex. A lot of conversations. We've talked about bridging the silos. We've talked about things like political commitment, ownership. We've talked about financing. At Africa CDC, we recognize that One Health is an approach, an encouraged approach for a way of life. And it can help us address some specific issues that Africa, as well as resource-limited settings, really face. Issues like AMR, that has been talked about a lot. Africa, for example, bears the highest burden. AMR by itself is killing more Africans than TB, malaria, and HIV put together. Zoonotic diseases, I think there are conversations that we have had, but it's more concerning that across the African continent, we're seeing an increase in terms of the outbreaks of zoonotic origin. Climate change isn't helping us either. Across the African continent, we are reporting things like drought, floods, which is contributing to outbreaks such as the ongoing cholera outbreak. But also, if you look at the way disease patterns such as dengue and mpox are evolving, we know that climate change definitely contributes. So as a Pan-African AU entity, what are the elements that we are putting in place to be able to support our member states to build resilient One Health systems? As a start, is making sure countries can drive and prioritize their own agenda. We recognize that One Health is an approach of working together. One Health can help us address a lot of things, but it has to be prioritized based on the needs of the country. So what we are doing at Africa CDC is, a lot of times you see that One Health comes into conversations. For example, we have an outbreak like Ebola. Everyone runs around and agrees to work together. One of the things that we are doing is that for countries, we're helping them shape what national policies should look like. I think we can agree in the room.
With respect to their own the ownership, right?
Yes, yes. So we're helping countries shape what their national One Health policies should look like. Means that we facilitate all sectors to be able to work together, but also encourage the countries to then define what areas and what priority areas that they need to work together and finance. This is quite important because it gives countries then a model that they're able to work together outside the outbreak and ensure that we have a means of a sustainable mechanism to continue to engage. This is quite important for countries because a lot of times we have informal ways of working together. So Africa CDC, as well as the relevant AU entities, we are helping countries to formalize these working mechanisms through national policies, governance manuals, as well as legal frameworks to be able to address this. I think it goes without saying that leadership by example is important to the African Union. At the level of the African Union, we have been able to demonstrate the highest level of sort of governance or commitment to One Health. Our heads of state and government of the African Union in 2020 made a political declaration and commitment to ensuring that they can facilitate countries and sectors to continue to work together under the One Health approach. This has been quite significant in addressing a lot of things. You know that last year at the UN General Assembly, for the first time in our history as Africa, we were able to articulate the needs of Africa. And one of the things that we called for also was the One Health approach to be reflected in that political declaration. I think in addition to that is how can we demonstrate the economic value for One Health? A lot of times people are saying, why do we need to work together? If countries don't understand that sectors sharing resources can help us address a lot of issues, for example, I'll give the COVID-19 pandemic. I think a lot of us forgot how closely we work together. We had our veterinary labs being the reference centers and testing centers for COVID-19. Our joint response system had veterinarians going for contact tracing and field investigation. A classic way of working together. So at Africa CDC, we are trying to ensure that we're able to institutionalize those kind of working mechanisms and encourage countries to work together. Lastly is talking about regionalism. No one single country can address the shared threat of AMR. If we all agree that no one single country, no one single sector can address this, this comes in the value of regional approach. So through our regional coordinating centers, our RCCs, we've been able to facilitate, I think, and we thank the government of Tunisia. 2 years ago, we were able to facilitate, for the first time, a Northern Africa regional advocacy workshop on One Health. And since then, we are seeing the message trickle down. Regionalism offers us an opportunity to learn from each other. The lessons from Tunisia can be applicable to the countries like Egypt. It can be applicable to Libya. We can learn lessons from each other because our settings when it comes to resource limitation are very similar. And we can potentially build models that can work for our different countries. And just to finish it off.
And for that,
yeah.
How can we make that happen? Do we need to put specific platforms where we can exchange on those experiences? How can we make it happen? How can we learn from Libya and Egypt, from Algeria and Tunisia, from Qatar?
That's fantastic. And not to put my colleague on the spot, the regional director of our RCC for this region has been passionate about championing this agenda. So we are already putting in mechanisms like a regional learning mechanism whereby countries can learn from each other. Under his leadership, we're also facilitating some knowledge exchange studies across countries. I think in the next 2 years, this region will be particularly significant in how we share some of these examples and demonstrate how best practice or regionalism could work. The most important thing is that Africa cannot stand alone or work alone. While we define our agenda as the African continent, we must also facilitate international partnerships that support our countries to prioritize their own agenda. In the past, a lot of partnerships are very prescriptive. We as Africa CDC, through the new public health order, call for an action-oriented partnership. I'm quite pleased to be joined by my colleague who we work very closely together, but I wanted to demonstrate some examples for countries to start to think about how we could lean into some of these international partnerships. Of course, the bank has been fantastic with the Pandemic Fund, which is a good example of how One Health can really bring in some value for showing the value of One Health, but most importantly, trickling down to the countries. At the level of the Africa CDC, we're also working with the European Union Commission through its countries at the Team Europe initiative. And in this, we have received some resources to be able to strengthen national coordination mechanisms. I think lastly is to think about also the regional partnership with the quadripartite. This has been very valuable to us as Africa CDC. Beyond the global quadripartite, we're also working with the regional quadripartite, whereby international institutions can now share resources to support countries. I think we must understand that with the changing economic landscape and investment landscape, the most important approach for us now as sectors, industries, organizations, and countries is that we need to work together to ensure that this limited resource available can translate to health interventions across our countries. Thank you.
Thank you, Dr. Halimi. I'll jump on that, and since you were talking about international institutions and also how you could cooperate on that, so Dr. François Esmiod, from a development financing perspective, and I think AFD is well positioned to answer this kind of question. What does it take to move from strategy to real-world impact when it comes to strengthen national One Health capacities? And please do not hesitate to jump in the future session, and also for you, and if you have any comments about what has been said, especially that you were addressed a specific comment from her.
Yes, thank you. So let me first just present the AFD group. So the AFD group, or Agence Française de Développement, is a French public institution that implements France's policy on development and international solidarity. It includes the AFD, which finances the public sector, its subsidiary Proparco, which focuses on the private sector financing, and Expertise France, which is the technical cooperation agency. And we work towards mainly two goals, which are the UN's Sustainable Development Goals and the Paris Agreement on Climate. And let me use this opportunity to thank our host and the Tunisian authorities for more than 30 years of fruitful and impactful collaboration with the AFD group here in Tunisia in several sectors, including the health sector, specifically in hospitals, e-health, and operationalization of a national health policy, as well as in the One Health sector through our support to the Institut Pasteur, particularly in the wastewater surveillance field, which is one of the key aspects of a One Health approach. Let me say as well, to respond to your question, that in the institutional sense, AFD, very much like other international organizations, we do recognize that the growing interdependence of climate, social, and economic upheavals affecting human, animal, and ecosystem health does indeed, and as was made clear by different speakers yesterday, calls for integrated and multi-sectoral approach. An objective, indeed, of a One Health approach, which is supported institutionally by the AFD group. So we have published recently a One Health joint paper with our German colleagues, and this strategy very much aligns with the French global health strategy, and indeed with the EU's global health strategy. At the African level, let me say that was striking yesterday. Not surprising, I want to say, because we know the quality and the quality of the work that has been done and the experience that the African continent has. But what was striking was that the level of expertise that has been developed in the One Health field, which allows the African continent to build on this experience to play indeed a key role in defining what we could say is very much a new approach to global health, one that emphasizes public health functions and public health institutions over specific health products or over specific diseases. We now have an approach which is very much welcome, that emphasizes strengthening of national public health functions through nationally owned public health institutions. So that is part of an answer I want to say to have to your question. The answer is really to strengthen national public health institutions with three priorities for which I want to say that international organizations have a supporting role. The first role indeed, is that of national governments, not only for a question of sustainability, but dare I say also a question of sovereignty as well. And in this international organization, indeed, international financing organizations such as the AFD stand ready to help and support national governments to fulfill this core function of their role. So with three priorities, one I mentioned is to strengthen national health systems with a particular focus on public health institutions and human resources. So just to highlight that the National Public Health Institutes are indeed called to play a key role in the One Health approach and need to be strengthened both from a governance standpoint and also from a sustainable financing standpoint to be able to fulfill all the roles necessary for the national public health institutions. The second priority is to leverage domestic financing. And in this, indeed, the international financing organizations do have a role, both to funnel international development assistance, but in the current upheaval in the global health financing context, more focus needs to be placed. Indeed, it already is in the way that international assistance can leverage or be leveraged through domestic financing. And indeed, this is an approach that is very much supported, and let me commend the initiative of Africa CDC to support member states in this approach. It's very much the approach adopted by the Pandemic Fund, and the idea here is to increase the level of domestic financing which can be allocated to ensure that the public health functions are fully functional. So international organizations do have a role in that, and we can work with national governments on that. And also, it is important, I think, to answer specifically your question. One of the avenues is really to explore new ways to leverage or to leverage domestic financing, for example, through specific taxes like sugar taxes. I know many countries, including France, have moved in this way, and I think that can be a way to ensure sustainable financing for public health functions with the added benefit that it also can have a beneficial public health impact as well. And last point, I think was already mentioned by one day. I just want to strengthen that. Was also a point I wanted to make, is to strengthen the regional cooperation. Let me highlight and very much welcome the advance of a declaration which mentions the creation of a regional center. And let me say that we very much support regional cooperation, be it through regional entities or through intergovernmental cooperation. And the AFD very much supports regional entities, including, well, we are a proud partner, of course, of Africa CDC, but more generally across the world as well. We support also the West African Health Organization, the Pacific Community Commission, the Caribbean Public Health Agency, and we do believe that
earlier, but if you have anything to add about that, especially on national priorities, without creating dependency and certainly not parallel systems.
So absolutely, I touched on that just to elaborate the point. So the first thing, as you mentioned, is not to duplicate existing systems. That's why we believe that public health institutes, when they exist, should and can play central roles. So that's why we believe in the importance of strengthening national public health institutions and allow them to fulfill the remit of their mandates. And it's also important from a financing point of view not to have what we call the eviction effect, right? To see that international financing does not offset or displace domestic financing. It's important that they should be leveraged. That's why we believe in an approach where they can be synergistic instead of opposing, and not to displace funding from the domestic space.
Do you think there is a risk that One Health in the Arab region remains as a donor-driven thing? Is there a risk that it remains as donor-driven in the region? Yeah, donor-driven. It always depends of donors. It's for both of you. That's why I'm trying to create a real discussion. That's why I'm telling you to jump in. Do not hesitate.
Yeah, sure. I think that is a really important question.
And you know what? Since you're answering, and again, to not lose lots of time, I'll add something since you're taking that. So if you could share more specific example, probably today from our continent, where this balance between international support and national ownership, so it's kind of the same question, was successfully achieved, and what elements of that model could be adapted to the MENA countries?
Thank you very much. And I think One Health, just like many health issues, has a risk of being donor dependent if countries don't take ownership. And this is why some of the conversations we are pushing on today's panel is about country ownership, country leadership, whereby countries can define their own priorities and agendas. I think one of the things that must come out of this conference is a bit of reflection. How do we start to domestically finance One Health interventions? This could look at things like our national action plans, our One Health strategies or joint contingency plans, or our One Health health national plans on climate change, for example. Really, we need to start to think how much as national governments can we start to put to address this shared threat. So I think in terms of that balance, some success stories. Of course, I must use Africa CDC as a bit of a success story because at the end of the day, we are owned by member states. Africa CDC is all of the member states present today. We are driven and led and really prioritizing our country priorities. A few things and examples that could work is some of the work that has been done around antimicrobial resistance. You see many countries have developed their national action plans. Across the African continent, 55 member states, we have 47 national action plans being developed, endorsed, already being implemented. One of the things that we are now seeing in countries, quite a number of countries, I won't list countries, is countries have now been able to look across sector, either through contribution, human resources, or office space. I think whether we like it or not, we need to start to quantify those contributions. A lot of times ministries take a step back and say, well, I don't have a budget to support, but you have the human capacity. And that is a resource that you can use to enable a One Health coordination mechanism in countries. You have the technical resources. You have academia, for example, coming into the discussions. I think a good example is also not missing the communities. We are starting to see many countries now starting to collect information around the communities, bringing communities to be part of their One Health coordination mechanisms. I think before I sort of wrap up, yes, One Health, we talk about sectors. We talk about different sectors. But we must remember the communities are the bedrock of every intervention we put in place. And as such, community perspective must be integrated in sort of the leadership, the prioritization of One Health interventions across the continent.
Thank you. If you have something to add?
Just to
Yeah,
highlight
sure.
some success stories as well. The value of regional cooperation. One of the success stories was recently we developed through Institut Pasteur de Guinée tools to be able to predict measles outbreak based on wastewater surveillance, and that was valuable because, of course, measles outbreaks does overwhelm health systems, and those tools were able to be shared with other countries and even potentially countries beyond Africa, given the fall in the measles vaccinations rates, unfortunately. And those tools being developed in these settings does show the value of trailblazing in the One Health approach, and does provide value. And that has the potential to be integrated into the public health functions of the countries, because it does show the value of better surveillance to anticipate such kinds of epidemics.
And also, since we have Dr. Mohamed Salah Ben Issa here, I could say that the Arab League can certainly make it a true political and societal priority. So thank you all. Maybe to take the word that you used a bit earlier, a shift. So in a few seconds, if there is one most urgent shift needed, either from international organizations or national actors to truly embed One Health approaches within national systems, what would that be in seconds? You could
So for me, it would be National Public Health Institute, strengthen National Public Health Institute.
And for you, Dr. Halimi?
It will be stronger governance and policy mechanisms to enable these collaborations.
Ok, thank you. Si vous êtes d'accord avec ça, vous pouvez applaudir. Voilà. Thank you. So now we'll move on. نواصل إذن في برنامجنا بالنسبة لليوم باش نطلب من الأستاذ هاشمي لوسي يتحق بيا هوني ونكون صافقوا عليه ونشجعوه. أستاذ مرحبا بك. بروفيسور تحب تكون في البيبيتر ولا تحب غادي تحبوني كيما تحب؟ اوكي رد بالك. Très bien. Donc on va commencer. Vous avez une présentation? Là, je vous pose. Moi, j'ai envie de vous poser une question. Vous voulez commencer avec présentation, c'est ça? Qui va تحب. Donc إذا بالنسبة للأستاذ هاشمي لوسير التقديم باش يكون حول اليوم from research to action innovative solutions for One Health. وبعد نجم نطرح عليك أسئلة.
Bonjour, donc
Régie pour la présentation.
Excellence et chers collègues. Donc je vais essayer de présenter en quelques mots d'ailleurs, c'est pas très long, des approches et quelques pistes qui vont nous aider à passer à l'action autour des aspects One Health et notamment en investissant dans les approches de recherche. Alors, est-ce que je peux avoir le diapo?
C'est bon, si vous pouvez lancer. C'est bon? C'est bon, Régie? Ouais. Merci beaucoup.
Alors, on va passer sur l'historique par rapport à l'approche One Health suivante. Est-ce que je peux les passer tout seul ou...
Vous avez un cliqueur? Il est là, voilà, merci.
Donc, alors, c'est bien d'insister pour rappeler la prise de conscience et les actions qui ont été menées et la planification et la stratégie qui a été développée par le comité quadripartite qui nous assiste d'abord dans cette conférence et qui a été à l'origine de la mise en place de Health Joint Plan of Action pour la période 2022-2026 et il a défini aussi, il a donné une autre définition qu'on a vue hier d'ailleurs sur les approches One Health et vraiment c'est un document qui est extrêmement utile pour les scientifiques, pour les gouvernements, pour les décideurs de le bien regarder. C'est un document de plusieurs pages, donc il est free sur le web et il est très instructif, donc je vous recommande de le lire et de voir ces choses. Alors, ce que je voulais faire montrer, c'est choisir d'après des études les top, quelles sont disons les menaces, les 3 menaces les plus importantes qui sont, disons, dans le cadre de One Health pour la région MENA, donc la région Moyen-Orient et Afrique du Nord. En premier, d'après ce qu'on appelle les dailies, d'après une façon de mesurer, on va dire, le poids des maladies ou les poids de ces menaces. Il y a ce qu'on appelle les maladies zoonotiques, endémiques ou émergentes. Endémiques, elles existent, ou émergentes, elles peuvent être nouvelles, comme le Covid-19 par exemple, ou le MERS. Donc il y a la brucellose, les leishmanioses, la rage continue à poser des problèmes dans notre région, le coronavirus, la tuberculose bovine. On n'a pas parlé de tuberculose bovine, mais la tuberculose bovine est, en Tunisie en tout cas, une fraction très importante de tuberculose est due à Mycobacterium bovis. Et elle donne des formes atypiques, des formes extrapulmonaires, entre autres. Et tout ça, c'est ce qui aggrave quelque part, c'est d'abord leur prévalence importante, le contact entre l'homme et l'animal qui va favoriser ces transmissions, et malheureusement, parfois, les surveillances épidémiologiques méritent d'être renforcées, notamment dans le cadre des surveillances intégrées, ce qu'on appelle, qui prend en considération la santé de l'homme, la santé de l'animal et certaines données et informations sur l'environnement. Tout à l'heure, on a parlé d'eau usée. C'est des informations qui viennent de l'environnement et qui nous aident à prendre des décisions et préparer et développer des stratégies pour, par exemple, savoir quels sont les risques et prendre les mesures qu'il faut. Alors, la deuxième menace, on en a beaucoup parlé hier et aujourd'hui, c'est l'histoire des résistances aux antimicrobiens. Donc, Monsieur le ministre de la Santé tunisien hier parlait donc des risques très importants et des décès qui vont avoir lieu d'ici 2050 s'il n'y a pas d'actions qui vont être prises. Et c'est effectivement le cas, et tout le monde est en train de parler de ça. Il n'y a pas beaucoup de nouveaux antibiotiques en développement. Il y a des recherches qui se font, mais et il y a de plus en plus de cas maintenant de résistance aux antibiotiques mortels. Donc vraiment, c'est quelque chose de très important. Elle existe aussi, malheureusement, en bonne priorité dans la région MENA, à cause de l'utilisation des antibiotiques non réglementés, etc. Et parmi les actions auxquelles on peut penser, c'est justement la réglementation et la mise en place de réglementation par rapport à l'utilisation des antibiotiques. Ça existe dans certains pays, mais si on peut coordonner, vu les spécificités et les particularités de notre région, ça peut être une bonne chose. Et la troisième qui se place en priorité aussi comme risque et comme menace pour la région, qui rentre dans le cadre de One Health, ce sont les maladies à transmission vectorielle et qui sont sensibles au climat. Je vais vous donner un petit exemple. Les vecteurs, donc ceux qui transmettent les maladies, sont sensibles au climat, une humidité, de température. Avec le réchauffement climatique, on l'a vu dans certains pays, moi j'ai l'exemple de l'Italie parce qu'il y a eu des études qui ont été faites. Donc l'Italie est un pays endémique pour la leishmaniose viscérale qui est transmise par un vecteur. Et vu le réchauffement climatique en Europe, donc les vecteurs, qui est le phlébotum, est en train de se trouver de plus en plus vers le nord de l'Italie, alors que normalement les cas étaient réservés dans le sud. Et ça donne des formes, entre autres, de leishmaniose canine qui peut se transmettre à l'homme. Qu'est-ce qui se passe? Donc la maladie va être transmise après par un vecteur parce qu'il y a eu des changements climatiques et il va toucher des zones qui sont avec des gens qui sont naïfs, ce qu'on appelle. C'est une maladie dans laquelle, quand on est en contact avec le parasite très jeune, on peut développer des résistances. Voilà, donc ça c'est juste pour montrer. Alors parmi ces maladies, il y a la dengue, les leishmanioses, la phalée du Rift, etc. Alors, maintenant, comment, et je passe donc à l'action, comment, disons, faire et retourner, on va dire, ces risques de santé et l'approche One Health comme driving des actions pour aller vers l'innovation pour la résilience. Donc, parmi les choses...
Donc l'innovation technologique peut représenter un vrai levier aujourd'hui dans l'approche One Health, c'est ça?
Exactement. L'idée, c'est que l'innovation...
Vous êtes presque en train de nous dire que vous voulez transformer les menaces en opportunités.
Exactement. Donc, il y a des... Donc, en fait, bon, il faut développer... Parce que la recherche, c'est elle qui va donner des preuves. Elle va donner des preuves d'abord sur des informations, sur les données réelles, sur le terrain, les modèles, etc. Mais aussi elle va apporter des solutions. Donc, il faut transformer donc, une dynamique de recherche et d'innovation, et c'est très important pour notre région. Cela peut se faire dans le cadre des pays. Il y a des programmes de soutien de la recherche dans les différents pays. Il faut qu'il y ait des appels à projets autour des projets pluridisciplinaires qui impliquent justement les différents acteurs de l'approche One Health, c'est-à-dire les médecins, les chercheurs, les scientifiques, les vétérinaires, le domaine de l'agriculture, etc., autour de projets structurants qui sont évalués par des experts pour faire des choses vraiment qui sont intéressantes et pertinentes à faire, et ça peut driver. Alors, il n'y a pas que les financements nationaux, il y a des bailleurs de fonds internationaux, l'Union européenne, les gros bailleurs de fonds internationaux, il y a même des fondations qui sont à l'écoute, et on a dans la région certains bailleurs de fonds et des fondations qui pourraient travailler sur ça. Donc, aux chercheurs et à ceux qui ont des idées, il ne faut pas dire « non, je n'ai pas de moyens », il faut aller chercher les moyens avec de bonnes idées et de bons projets et surtout réunir les équipes pluridisciplinaires. Et c'est dans la pluridisciplinarité qu'il peut y avoir, disons, l'innovation et la recherche structurante. Alors, donc, si on peut passer... Donc, établir des recherches et des réseaux de recherche qui impliquent différentes spécialités et créer peut-être des actions au niveau de la région pour supporter les coordinations à l'échelle nationale avec des institutions de recherche existantes. Donc c'est bien, dans la coordination au niveau de la région, de permettre, dans le cadre de la gestion de cette coordination, la mise en réseau de certains centres et de certaines structures académiques de recherche pour qu'ils puissent travailler, échanger et développer des idées et des recherches autour de l'approche One Health, qui peut être supportée par le comité quadripartite, qui peut être supporté peut-être par la Banque mondiale, mais aussi d'autres bailleurs de fonds et les financements locaux. Alors, l'autre chose, c'est la formation. Donc, si on veut décliner et si on veut sensibiliser et si on veut avoir demain des gens et des ressources humaines capables de manager les aspects par rapport à One Health et apporter des solutions, c'est bien d'introduire dans les formations, dans les cursus académiques, les études, les facultés de médecine, inclure donc des modules sur One Health, les facultés de sciences vétérinaires, les sciences de l'environnement, etc. Avoir des modules qui sont intégrés, qui tournent autour des approches One Health pour que l'étudiant, quand il va dans ces spécialités-là, il est déjà préparé pour que plus tard, donc, il pourra intégrer et s'impliquer plus facilement dans les approches santé unique. Il y a la création de MOOC, etc. Et tout ça peut être fait à l'échelle des pays ou des régions, parce que, quand on parle de région, parce qu'on a des spécificités. On a une façon d'interagir, on a parfois des choses, un héritage commun, et donc ça peut avoir un certain sens. Alors, parmi les choses qui peuvent être faites, et on en a parlé, c'est à développer un système de plateforme qui intègre les données de la santé humaine, animale et environnementale. Ça, c'est vraiment quelque chose de très important. Hier, ma collègue Nissaf Ben Ali en a parlé. Il y a des actions qui se font dans certaines structures. Ce qu'il faut maintenant, c'est échanger les informations ou avoir des plateformes qui sont accessibles par les différents acteurs. Et ça, c'est faisable. Ça peut être ce qu'on appelle des fiches syndromiques. On peut mettre des syndromes et on voit leur fréquence et il y a des alertes qui arrivent. Ça peut être plusieurs façons de faire. Il y a des exemples et des pays qui ont avancé dans ce domaine. Et l'intelligence artificielle et la modélisation. Alors, maintenant, je voulais rajouter juste que les technologies aussi et l'innovation technologique, ça peut aider, et ce sont les outils qui sont utilisés et dont on a besoin. Par exemple, très rapidement, l'intelligence artificielle, elle est très importante pour prédire les maladies, pour les menaces, pour monitorer même l'environnement, tout ce qui est les systèmes d'information géographique, les aspects, bien sûr, les biotechnologies, le développement de vaccins. Tout à l'heure, on va parler de développement de vaccins, qui est une des réponses à des pandémies, à des épidémies, regardez avec Covid-19 et avec d'autres situations. Les diagnostics qui sont point of care, c'est-à-dire auprès du patient. Il y a tout ce qui est donc precision agriculture, ça touche tous les domaines qui sont concernés par l'approche One Health. Et ce que je voulais dire pour finir ici, c'est qu'en fait, c'est vrai qu'il y a des menaces en santé globale, il y a des risques de pandémie, et c'est pour ça qu'on se prépare et c'est pour ça qu'on utilise des stratégies One Health, mais en faisant ça, on peut développer des capacités. Le fait d'augmenter les capacités locales, cela supporte la création des biotech, des start-up, des relations publiques-privées, des formations. Quand on développe des systèmes réglementaires, par exemple, pour des choses qui régulent l'agriculture ou qui régulent même les vaccins et tout ça, avoir des labels, c'est important, ça peut être intéressant, ça peut intéresser le marché. Investir dans les aspects de climat et les changements climatiques et la résilience peut impliquer donc le développement d'infrastructures et des programmes et tout ça. Juste pour dire à la fin et pour conclure, c'est que c'est vrai qu'il y a des menaces, mais si on les transforme, et si on développe des recherches, et si on développe les technologies, non seulement on peut répondre à ces menaces pour plus de résilience, mais aussi on peut contribuer au développement économique et social des pays, puisqu'on va développer les technologies et on va baser, disons, l'économie sur plus de connaissances. Et je vous remercie.
Merci beaucoup. Merci beaucoup. On va essayer de passer à la suite, mais une petite remarque quand même. La Tunisie l'a montré, l'a démontré avec Instadeep, hein, professeur Louzir, qui ont fini carrément par devenir, c'est pour ça qu'ils ont été rachetés derrière, par devenir le modèle dans
Oui,
le
oui.
monde de prédiction et d'anticipation.
Exactement.
Justement. Donc ça prouve que grâce à l'IA aujourd'hui, on peut faire un grand shift. Pour ça.
L'IA, elle est partout dans l'échelle de valeur de tout ce qui est santé, santé humaine, animale, environnement. C'est extraordinaire. Il y a aussi quelque chose par rapport à l'IA. Moi, je fais partie, et ça c'est juste pour information, d'une sorte de commission Lancet qui regarde quelles sont les menaces en santé globale dans le 21e siècle. Et donc, on mesure un petit peu les menaces en santé, comme les maladies, etc., qui risquent d'être, disons, des menaces. Et la première menace en santé globale du 21e siècle, c'est Misused Artificial Intelligence. Donc, l'intelligence artificielle, quand elle est utilisée de façon malveillante ou par des erreurs, elle constitue actuellement la première menace en santé d'après les modèles mathématiques et d'après les études qui ont été faites par les équipes de l'Institute of Health Metrics and Evaluation à Washington, avec lesquels on collabore. Donc, juste pour savoir que l'intelligence artificielle peut apporter énormément de réponses dans tout le système, mais si elle est utilisée de façon malveillante, elle peut être une menace.
Merci beaucoup. Merci, professeur Heshmil aussi. Vous avez parlé de label aussi tout à l'heure, c'est très important. On peut trouver cette présentation quelque part. J'ai vu beaucoup de gens essayer de prendre des photos, c'était super intéressant. Le temps, malheureusement, ne permettait pas d'aller plus en détail, donc je pense qu'elle pourra être envoyée aux participants. Donc, نواصل إذن. نطلب الدكتور محمد رابحي دايركتور جنرال مينستري اوف هيلث جوفرمنت اوف تونيزيا يلتحق بنا مدير عام بوزاره الصحه باش يكون باش يدير الحوار الجاي والورشه القادمه حول practitioner perspective one health challenges and opportunities in MENA region. تفضل دكتور رابحي، مرحبا بك. باش يلتحقوا بي دكتور نيكولا دالتيريو دايركتور جنرال اي تي اس تيرامو، ودكتور فيليب ايجيمان فايس بريزيدنت اف ام اتش، دكتور لوجين الكودماني immediate past president World Medical Association, and Dr. Mohammed Arbi, professor National School of Veterinary Medicine of Sidi Thabit. ممكن نصفق على الاورجنايزنج تيم زي ما نعرف روحي نمشي بسرعه انا معناتها خليهم نربحوا شويه الوقت. نعرف فما ناس ماشيه تتجول في سيدي بوسعيد من بعد وتستنى شفت بالابتسامه والضحكه نفهموا. قد ما نكونوا في الوقت قد ما هما يتجولوا في سيدي بوسعيد. دكتور رابح
ان شاء الله باش نحاولوا. شكرا. بسم الله الرحمن الرحيم. معالي الوزراء، السادة الحضور الكرام، صباح الخير. أهلا وسهلا بالجميع ومرحبا بضيوفنا الكرام، وشكرا على لجنة التنظيم على المجهود الكبير المبذول لتأمين حسن سير هذا المؤتمر الهام والهام جدا، والذي يتناول موضوع يتعلق بحياة الأفراد والمجتمعات. شكرا جزيلا للأستاذ الهاشمي الوزير رئيس اللجنة العلمية لهذا المؤتمر على مداخلته الهامة والهامة جدا، والتي أعطتنا لمحة حول آخر التطورات العلمية والمبتكرة التي من شأنها أن تسهل تطبيق نهج الصحة الواحدة في مختلف المجالات. طبعا هناك تحديات كبيرة وكثيرة في هذا الإطار، لكننا أيضا أمام فرص حقيقية لإرساء أسس متينة لصحة واحدة متكاملة ومستدامة في منطقتنا. خلال هذه الحصة باش نحاولوا نسرع أكثر ما يمكن، سيتمحور النقاش حول التحديات والفرص المتاحة لإرساء توجه الصحة الواحدة في منطقة الشرق الأوسط وشمال أفريقيا، حيث سنتعرف على هذه التحديات والفرص من خلال برمجة 4 مداخلات متكاملة بينها وتجمع بين العلم، الجانب التطبيقي والرؤية المستقبلية لتكون نبراسا لنا في تعزيز الصحة الواحدة في منطقتنا. هذه المداخلات سوف تتعرض إلى الأمراض حيوانية المنشأ، مقاومة مضادات الميكروبات، السلامة الصحية للأغذية وما أدراك ما السلامة الصحية للأغذية، وتأثير تغير المناخ وتدهور البيئة على الصحة العامة. بخصوص المداخلة الأولى والتي سوف تتعرض أو تحوم حول الأمراض حيوانية المنشأ، الحقيقة كلنا نعرف اللي الأمراض حيوانية المنشأ تشكل تهديد عالمي متزايد، إذ تتسبب في أكثر من 60% من الأمراض المعدية الجديدة التي تصيب الإنسان. هذه الأمراض التي تنتقل من الحيوان إلى الإنسان غالباً ما تنتقل بواسطة النواقل، كما أن تغير المناخ وزيادة التنقلات البشرية تزيد من فرص انتشار هذه الأمراض. ووفقاً لمنظمة الصحة العالمية، أكثر من 700 ألف حالة وفاة سنوياً مرتبطة بأمراض حيوانية المنشأ. ففي هذا الإطار تندرج المداخلة الأولى والتي تتناول تهديدات الأمراض حيوانية المنشأ، تعزيز المراقبة الجينية ومكافحة الأمراض المنقولة بواسطة النواقل. يقدمها لنا الدكتور نيكولا دالتيريو، المدير العام لمعهد EZS تيرامو بإيطاليا، وهو طبيب بيطري متخصص في تغذية الحيوان، حاصل على رتبة درجة الماجستير الدولية في سلامة الأغذية من جامعة بولونيا. تفضل دكتور نيكولا.
Excellencies, dear colleagues, dear friends, good morning. First of all, I would like to thank the organizers for the invitation and for the opportunity to speak in this important meeting on One Health in the MENA region. I will skip the first part of my intervention because all of us, we heard the importance of link between animal health and human health yesterday in the other speeches. So, okay. It's a little bit slow, maybe. Someone can help me? What is this? Okay. The next, what is? Okay. Sorry. One Health is a movement, so is ongoing, and we can improve some aspects. For example, the organization, low awareness among decision makers, lack of coordination between sectors like human and animal health, and limited funding and staff. Another point to implement is integrated surveillance systems, delight detection, fragmented data systems, lack of information sharing, outbreak response, limited cross-sector responsiveness and planning. Let me spend a few words about the institution that I have the honor to lead. We are a public health institution, a part of National Health Services, and we have a long-standing experience in animal disease control, zoonosis, food safety, and environmental protection. Despite we work in the domain of veterinary services, we are under the umbrella of Ministry of Health in Italy. In April 2024, FAO appointed us as reference center for One Health, probably because we use this approach since the data of our foundation in 1941. In 2017, Italian Ministry of Health appointed us as National Reference Center for Genomic and Bioinformatics for both pathogen, human and animal side. Genomic surveillance is one of the core of our activities and date back since 2009 when we bought the first sequencer. Our center of reference is based on two pillars. One is the genomic, sorry. I don't know why. Please. Please. Please, help me. The National Reference Center of Genomic and Bioinformatics is based on two pillars. The first one is composed by, no, let her. The first one is a group of scientists that manage everything regarding genomic analysis. And the second one is a group of scientists that manage everything regarding bioinformatic system. All of the data gathered are in our server farm in our institute and is the IT system of our Ministry of Health. Both of this group of scientists are strongly connected by the other sector of our institute, and they are completely integrated in our activities. So, with this data, we supported our Ministry of Health in order to implement our action plan, our strategy, and in general, the policy of our Ministry of Health. Now I am in the core of my presentation, that is the two initiatives using One Health approach in this region, in MENA region. The first one is MedNet for One Health in Tunisia. This picture is related to the official launch of this project. And allow me to thank the Ministry of Health in Tunisia, Tunisian Ministry of Health, WHO Tunis, and the Agency for Development and Cooperation of Italian government. Let me thank also Dr. Lusir, because everything started with his contribution. Thank you, Dr. Lusir. As I said, this project is implemented in collaboration with these authorities and is funded by Italian agency. The geographic area is Tunisia, obviously, and we have six health institutions involved in that, such as Institut Pasteur de Tunis, Hospital Charles-Nicolle de Tunis, l'Hôpital de Sfax, l'Hôpital de Sousse, et l'Hôpital de Monastir. What we want to do with this project, we want to harmonize molecular diagnostic for respiratory and neurological syndrome, often caused by infection agent and of zoonotic origin, genomic sequencing to build a local capacity in next generation sequencing, and bioinformatic training, data digitalization, and sharing genomic information securely and real time. The last is community engagement in health risk communication. As we learned yesterday in several presentations, the engagement of the community is a key point to reach a good goal. Expected result: development of national infection surveillance platform that includes molecular diagnostic results, data sequences generated by pathogen surveillance, and metadata. These 3 points represent the cutting edge of this project. This approach, including the principles of data management and community engagement, could be enlarged to other MENA countries. So, please. May I have some water, please? Another project is, thank you so much. The second project is Provna project. This project is under the auspice of WOA. Geographical area is North Africa. The countries involved are Algeria, Egypt, Libya, Mauritania, Morocco, and Tunisia. And the local partners are veterinary services in the central competent authorities. General objective. The topic of this project is Rift Valley fever. General objective is define the ecoregion through satellite data, identification of similar ecological areas called ecoregion according to specific environmental and climatic factors, such as vegetation, rainfall, temperature, and so on. So we can develop maps of suitability based on encouraging using historical field data in order to maximize the effort and target the surveillance on the field. This project addresses the vector-borne disease spread by insects such as mosquito and ticks and so on. They represent 70% of all infection disease globally, and they cause around 700,000 deaths each year. This project comes from our experience in Italy, where we established 22 ecoregions. And for example, for Culicoides simicola, only 2 ecoregions are competent. These ecoregions are perfectly overlapping.
Dr. Nicola, quickly, please.
Yes. The last one, this approach can be scalable for other areas, such as, for example, for tsetse fly in Africa, SADC, and Balkan area for West Nile CCHF. Go fast. This is our best challenge. This is the new headquarters that we are building here in Teramo. In the left, the current situation, and the right, the finished work. Thank you.
شكرا جزيلا دكتور نيكولا. بعد أن سلط الضوء الدكتور نيكولا حول كيفية استخدام المراقبة الجينية لتتبع هذه الأمراض والتصدي لها وأهمية العمل المشترك بين القطاعات الصحية البيطرية والبيئية ضمن إطار الصحة الواحدة، أود طرح سؤال وأود أيضا إجابة سريعة لو سمحتم، لأن عندنا مشكل الوقت. ما هي الآليات التي يمكن تفعيلها لضمان تبادل المعطيات الجينية الخاصة بالعوامل الممرضة بين مختلف القطاعات، سواء كان الصحة البيطرية، الصحة العامة، وسلامة الأغذية بشكل آني حتى يتم اتخاذ الإجراءات في وقتها؟
In my opinion, the key point is harmonize the capacity of diagnostic and gather the data and make available this data for the decision maker. This is the key point, in my opinion.
شكرا جزيلا. نمر إلى المداخلة الثانية والتي سوف تتناول مقاومة مضادات الميكروبات. قبل إحالة الكلمة لضيف الكريم أريد التأكيد على أن مقاومة مضادات الميكروبات هي واحدة من أكبر التهديدات الصحية التي تواجه البشرية اليوم. في هذا الإطار تندرج المداخلة الثانية: مقاومة مضادات الميكروبات في الواقع العملي، التصدي لتهديد واضح وحالي. سيقدمها الدكتور فيليب إيجيمان، نائب رئيس الاتحاد الطبي السويسري، وهو طبيب استشاري أول في مستشفى جامعة لوزان بسويسرا، وهو مختص في الطب الباطني، الأمراض المعدية والعناية المركزة، ويتمتع بخبرة سريرية تزيد عن 30 عاماً. لكم الكلمة دكتور فيليب، ورجائي الإسراع أكثر ما يمكن لأنه عندنا مشكل وقت.
Monsieur le directeur, Vos Excellences, Mesdames et Messieurs les représentants des organisations internationales en vos titres et fonctions, chers collègues, chers invités. Merci beaucoup tout d'abord au professeur Ferjani d'avoir pensé à m'inviter pour vous parler de quelque chose qui m'intéresse depuis très longtemps. Mais tout d'abord, j'ai réalisé que en fait, l'histoire entre la Tunisie et la région d'où je viens, Lausanne, est plus que millénaire, puisqu'il semble que Hannibal aurait pu traverser les Alpes en passant par Lausanne, le long du lac Léman. D'abord, il faut peut-être juste préciser ce que sont les antimicrobiens. Eh bien, il s'agit tout d'abord des antibiotiques qui tuent les microbes, les micro-organismes,
Ensuite, il y a les antiviraux, dont on parle un petit peu moins, mais qui ont gagné en importance. Les antifungiques, on n'en a pas beaucoup parlé, mais c'est quelque chose qui est important, en particulier dans l'agriculture, puisque en fait, on dépend pour notre vie de l'agriculture. Et puis enfin, il y a les antiparasitiques, dont nous avons aussi parlé. Alors imaginez maintenant un monde sans toutes ces substances. Eh bien, nous sommes face à des difficultés extrêmement importantes. Et récemment, dans Nature Communication, pour les pays en voie de développement et les pays déjà modérément développés, eh bien, vous voyez qu'en 20 ans, les résistances à toute une série d'antibiotiques ont pratiquement doublé. Et ça, c'est quelque chose qui est extrêmement grave parce que là, nous sommes vraiment confrontés à quelque chose pour lequel nous devons nous mettre ensemble pour lutter et pour survivre. Et il a récemment été dit, et vous le savez, que si on ne fait rien, eh bien, nous aurons plus de morts d'ici 20 ans des résistances aux antibiotiques que du cancer, pour lequel on engage beaucoup plus de moyens pour la recherche. Plus de morts potentiellement des antibiotiques résistants microbes que du cancer, et c'est quelque chose qui doit vraiment nous concerner. C'est vraiment une pandémie silencieuse, globale, mais qui est extrêmement importante. Comment en sommes-nous arrivés là? Eh bien, c'est intéressant, puisque pendant pratiquement un demi-siècle, nous avons appris, et j'ai fait partie de ces gens-là, que face à une infection, il faut donner des antibiotiques. Mais quand on donne des antibiotiques, on crée des résistances, donc on élargit le spectre des antibiotiques, on augmente encore la résistance, et à cause de ça, nos traitements sont inappropriés et nous augmentons la mortalité. C'est ce que nous vivons dans nos hôpitaux depuis maintenant bientôt 2 décennies. Et en fait, c'est quelque chose, il faut toujours regarder dans le passé. Regardez ce papier extraordinaire dans le Lancet, 1948, 3 ans après l'introduction de la pénicilline en Angleterre. Eh bien, on décrit déjà des staphylocoques résistants à la pénicilline. Et le principal facteur de risque en bas, en bleu, c'est l'exposition préalable à la pénicilline. Tout était dit. Nous sommes entrés dans une course contre la montre pour essayer de vaincre les micro-organismes. Après, nous devons aussi réaliser que nous sommes faits d'environ 10 puissance 13 cellules, mais que nous sommes en réalité un microbiote complexe, avec beaucoup de microbes sur la peau, encore plus dans le tube digestif. Et quand vous exposez ce système à des antibiotiques, eh bien, vous imaginez bien qu'il se passe des choses. Et je n'ai pas résisté à l'envie de vous montrer ce papier fantastique qui montre qu'après une simple dose unique d'antibiotiques par voie orale d'une capsule d'un antibiotique macrolide, vous avez ici la flore orale, les streptocoques que nous avons dans la bouche, qui deviennent extrêmement rapidement résistants en moins d'1 semaine. Et la suite du diagramme montre que ces résistances sont présentes encore pendant plusieurs mois, parce que les micro-organismes qui sont arrivés sur Terre avant nous ont développé énormément de mécanismes pour résister aux antibiotiques. Et je dois ici saluer cette initiative magnifique des 4 organisations, comme il a été fait mention par l'orateur de la session précédente, qui ont développé tout un concept duquel vous pouvez vraiment et nous pouvons nous inspirer pour essayer d'aller de l'avant. Alors je vais vous montrer ce que j'essaye de montrer à mes collègues médecins, réanimateurs depuis bientôt 20 ans. Eh bien, il faut d'abord prendre toutes sortes de mesures et c'est une vraie stratégie qui doit être mise en place. Tout d'abord, il faut surveiller, ça a été déjà dit à plusieurs reprises, avant de planifier des interventions qui puissent être couronnées de succès. Si vous tapez à l'aveugle, vous n'arrivez sur rien. Ensuite, le contrôle de l'infection, c'est quelque chose d'absolument majeur et il faut éviter la transmission d'une personne à l'autre par l'hygiène manuelle. Je travaille depuis plus de 20 ans avec le professeur Didier Pittet et vous savez que des mains propres permettent de sauver des vies grâce à la friction et à la désinfection hydroalcoolique. Ensuite, il faut ne pas oublier les masques. Il y a eu de nombreuses controverses, mais souvenez-vous qu'il y a peu d'années, il a maintenant enfin été possible de montrer que de porter des masques peut réduire la transmission aéroportée, que ce soit pour celui qui émet ou celui qui risque de recevoir ces micro-organismes. Maintenant, le pas suivant, c'est de contrôler les antibiotiques. Et ça, je crois que c'est le cœur de la stratégie. Il faut vraiment apprendre à mieux utiliser les antibiotiques, qui sont une ressource qui devient rare en termes d'efficacité et qui est extrêmement coûteuse. Maintenant, nous devons aussi réaliser que nous utilisons bien plus d'antibiotiques dans les animaux que nous utilisons comme alimentation que chez l'être humain. Et ces données sont valables partout dans le monde. Et c'est extrêmement important de réaliser que les antibiotiques, c'est un cycle vraiment compliqué. Ça a déjà été bien montré. Et nous devons essayer d'intervenir à tous les niveaux pour améliorer l'utilisation de ces antibiotiques. Ensuite, pour ça, nous avons développé des modules d'éducation. Et il faut ici, encore une fois, saluer l'OMS qui a maintenant décidé de mettre des moyens importants pour promouvoir cette éducation d'une meilleure utilisation des antibiotiques. Conceptuellement, c'est relativement simple. Excusez-moi, le dia précédent, c'était pour montrer que dans la région MENA, il y a une initiative avec de la formation web, et c'est extrêmement important, et je vous félicite pour ça. Et nous devons éduquer les médecins dans les hôpitaux, et nous avons appris qu'il n'est plus nécessaire de donner des antibiotiques dans l'heure qui suit le développement d'un état fébrile, mais encore plus important dans la population. Et la principale source d'utilisation inappropriée d'antibiotiques dans la population, ce sont les infections virales respiratoires. Et là, il y a vraiment un progrès à réaliser. Donc, il faut vraiment éduquer la population. Ensuite, il y a un petit souci. Ensuite, on peut utiliser des outils pour les médecins qui sont de monitorer l'efficacité de ces antibiotiques. Est-ce qu'on en donne assez? Et puis, on peut introduire ici les biomarqueurs. Je n'aurai pas le temps d'en parler ici, mais si vous combinez des doses adéquates d'antibiotiques et l'utilisation de biomarqueurs, on peut vraiment individualiser le traitement antibiotique pour chaque patient. Et ça, c'est vraiment une clé dans la réussite pour éviter l'escalade. Maintenant, il y a aussi des formes innovantes. Les antibiotiques inhalés par aérosol. Alors, on l'a un peu oublié, mais disons, on peut atteindre des taux extrêmement importants d'antibiotiques là où il y a des infections bactériennes dans les poumons. Alors, c'est quelque chose qui a malheureusement été un tout petit peu oublié, parce que déjà en 1940, à Boston, eh bien, un collègue a aérosolisé de la pénicilline pour traiter une pneumonie à staphylocoque. Et si je prends ici la colistine, qui est un antibiotique de réserve utilisé dans la plupart des pays, vous le connaissez ce nom, si vous le donnez en inhalation, vous avez des taux qui sont 1000 fois plus élevés que si vous le donnez par voie intraveineuse. Et c'est important parce que regardez la courbe rouge, c'est l'efficacité pour tuer les bactéries dans le poumon avec l'inhalation par rapport à la courbe bleue où au bout de 4 heures de temps, votre antibiotique n'est plus efficace si vous le donnez par le goutte à goutte. Donc vraiment, ces thérapies innovantes sont quelque chose vers lequel on doit se projeter. Les anticorps monoclonaux, je serai extrêmement rapide, j'ai participé à quelques grandes études, on peut cibler les toxines qui font du dégât chez les patients, on peut aider notre système immunitaire à tuer les micro-organismes, on peut agir sur les facteurs de virulence et enfin, on peut faire quelque chose sur le fameux biofilm dans lequel se cachent les bactéries. Ensuite, les phages, c'est quelque chose qu'on a un peu oublié. Les phages sont des virus qui tuent les bactéries de manière extrêmement spécifique, contrairement aux antibiotiques. Et quand les bactéries du type spécifique n'existent plus, les phages meurent, donc il n'y a pas de risque environnemental. C'est important parce qu'on pense maintenant que les phages, qui sont beaucoup plus nombreux que les virus, permettent de réguler le microbiote. Donc là, il y a vraiment des progrès importants à faire. Les phages ont été développés avant les antibiotiques. Il y a bientôt une centaine d'années, les antibiotiques ont fait pratiquement disparaître ces technologies qui sont en train de réémerger et c'est quelque chose sur lequel il faut vraiment investir pour l'avenir. Et puis enfin, je vais terminer par un sujet extrêmement important qui est la vaccination. Ça sera traité dans la session suivante, mais il y a des évidences maintenant que de prévenir les infections virales respiratoires permet de diminuer les infections secondaires, en particulier pneumocoque, un papier récent, et ça, c'est une approche importante. Donc, ça sera traité dans la session suivante, c'est extrêmement important. Je vous remercie de l'invitation, de votre attention, et si vous voulez en savoir plus, je vous invite à venir à l'ICPIC à Genève en septembre, où tous ces sujets seront abordés de manière détaillée. Voilà, encore une fois, merci beaucoup pour l'invitation et de votre attention.
شكرا جزيلا الدكتور فيليب على هذه المداخلة القيمة، والتي استعرضتم من خلالها الآليات الرئيسية وراء مقاومة مضادات الميكروبات والعوامل التي تسهم في انتشارها السريع، وما هي أهم مجالات التدخل الممكن للحد من أثارها، واللي تشمل أنظمة المراقبة، تدابير الوقاية من العدوى بما في ذلك غسل اليدين، برامج ترشيد استخدام المضادات الحيوية إلى جانب استراتيجيات مبتكرة مثل العلاج بالبكتيريوفاج والتطعيم. شكرا جزيلا على مداخلتكم القيمة. سوف لن أطرح السؤال ربحا للوقت، ونمر مباشرة المداخلة الثالثة، والتي تتعرض إلى السلامة الصحية للأغذية. قبل أن أمرر الكلمة للدكتورة، أود أن أعرج على أن السلامة الصحية للأغذية والأمن الغذائي تعتبر من الركائز الأساسية لصحة الإنسان، إذ يواجه الشرق الأوسط وشمال إفريقيا تحديات كبيرة في تأمين الغذاء الكافي والآمن بسبب النمو السكاني، النزاعات وتغير المناخ، حيث يعاني حوالي 55 مليون شخص في المنطقة من انعدام الأمن الغذائي، وهذا حسب تقرير منظمة الأغذية والزراعة لعام 2023. في هذا الإطار تأتي المداخلة الثالثة، وهي تعزيز الصحة، سلامة الغذاء والأمن الغذائي في منطقة الشرق الأوسط وشمال إفريقيا. ستقدمها الدكتورة لجين القدماني، وهي الرئيسة السابقة للرابطة الطبية العالمية، وهي منظمة دولية تمثل الأطباء حول العالم، وتمثل أكثر من 10 ملايين طبيب حول العالم، وتشغل حالياً منصب قائدة شبكات المهنيين الصحيين في منظمة الرعاية الصحية دون ضرر، وهي منظمة دولية غير حكومية تعمل على تحويل قطاع الرعاية الصحية ليكون أكثر استدامة من الناحية البيئية والاجتماعية والاقتصادية، وقد عملت مع عدد من المنظمات المرموقة بما في ذلك الاتحاد الدولي لجمعيات طلبة الطب ومنظمة النساء في الصحة العالمية. الدكتورة قدماني طبيبة طوارئ متخصصة في إدارة وسياسات واقتصاديات الصحة العالمية، وهي خبيرة في نظم الأغذية المستدامة والسياسات العالمية المتعلقة بالصحة وتغير المناخ. لكم الكلمة دكتورة لجين.
شكرا جزيلا لك دكتور. Your Excellencies, dear guests, esteemed colleagues, ladies and gentlemen, Aslama. I'm very honored to stand before you today on behalf of the World Medical Association just to speak to you briefly about food security in the region from a food system perspective. But before I do that, for the ones who never heard of us, the World Medical Association is present in over 116 countries, and we have the Medical Association of Tunisia, a proud member and a member of our council. We advocate for the benefits of physicians as well as patients for the highest standards of healthcare, medical ethics, and health for all everywhere. Now, before I focus on the region, let's just take a step back and focus on the globe. The recent report that was launched this year, the Global Report on Food Crisis, is represented in this figure, where you have the blue circle, 10 countries with the largest number of people facing the highest level of acute food insecurity, and the green circle with the largest share of people. You might notice that we have countries from the MENA region presented in both circles, especially in the middle, where they have the largest number and the largest share. If we follow the regional distribution of countries according to WHO, so we have Sudan, Yemen, and Syrian Arab Republic. And also in the green circle, we have the Palestine, particularly the Gaza Strip. and as well Pakistan on the bottom of the blue circle, the largest number of people of acute food insecurity. If we zoom in into the region itself, the report indicated that over 31 million people in the region facing the high level of acute food insecurity. And it's highlighted in 8 countries. In Gaza Strip, 100% of the population are facing food insecurity. If I may remind you that this data and this report was published before the imposed siege on Gaza, as well as before the initiation of the unsafe, very limited humanitarian aid distribution. So it might also then not include the rates of famine and also the mortality rate due to famine in the Gaza region. We have around 48% in Yemen, and if we look down, it also included the refugees in Jordan, Algeria, Egypt, as well as Iraq. Why is this? Why are we talking about food security and food system from a One Health perspective? Now, there are interlinkages between climate system, food system, and ecosystem that include land, water, ocean, as well as the socioeconomic system. And this is a great reminder that how the food system is structured. That is from farm to fork. So we have the crops, livestock, aquaculture, or the food production. We have the processing, value chains, trade, and markets. And then we have the consumption, the demands, consumptions, and diet. And let's not forget, of course, the food loss and waste. That system itself has its own contribution to the climate, and actually the food system is responsible for over 1/3 of the greenhouse gas emissions, as well as its impact on biodiversity. It's the major driver of biodiversity loss, and they're responsible for around 80% of the ocean purifications. And then it has also an impact on socioeconomic benefit when we talk about housing, education, affordability, and accessibility for not just food, but as well as healthy diets. The food system is impacted by the climate change. And if I mention a certain example, in the MENA region, this region is considered to be the most water-stressed region in the world. And that impacts, of course, the food systems, particularly when it comes from a food security perspective. There was a great report that mentioned in 2023, in Morocco, they had around 28% drop in rainfall that decreased the agriculture output by 20%. In Algeria, that decreased the cereal harvest by 12%. And in Tunisia, it also affected when it comes to the cereal production reduction, plummeting to by 80%. If you look at Jordan, it is estimated that due to water scarcity, agriculture productivity could drop annually by 1.2%. And of course, that has economic impact by dropping the Jordan's economy up to $29 million each year. If we look at Iraq, the government of Iraq also published an interesting statistics that mentioned that the country has lost 61% of its agricultural land. And the desertification has almost halved the Iraq's farmland due to climate change and environmental impact in the country. Our food systems does not only impact from a climate change perspective, but the entire planetary boundaries. We have 9 planetary boundaries that are clearly demonstrated in this slide. We are surpassing 6 out of those 9 planetary boundaries. And the yellow color demonstrates the food system contribution. That was in relation to biosphere integrity, climate change, land system use, fresh water, biochemical flows, and novel entities. Novel entities means the industrial materials that introduced by the human into the environment, including plastics and other industrial elements. But our food systems, they're not only killing our planet, they're also killing us. In the region, we have a high malnutrition rates. 1 in 3 children in the region are malnourished. And here demonstrates children under the age of 5 in relation to stunting, wasting, anemia, and overweight, as well as children from 5 to 19, where we have the issue of undernutrition as well as overconsumption. And of course, women and the reproductive, in the reproductive age. Let's just stop talking about challenges and talk about solutions and opportunities for the region. It's quite important to follow the One Health approach when we talk about not just food security, but also food system that needs to deliver healthy and sustainable food for all. The One Health approach, looking from human health, animal health, as well as an environment, not just at the regional level, but as well as at the national level. That could be through the One Health impact assessment, as well as integrating the One Health principles that were beautifully presented to us yesterday during the day one of the conference. Second, we need a system-level action from farm to fork. Sustainable food production practices that transform our food production from carbon emitting to carbon sink. We need to have a dietary shift towards healthy and sustainable diets, and of course, slashing food loss and waste. Third, innovation, leveraging technologies, a new innovation, data and traditional knowledge. And if I can mention one specific example, Egypt, back in 2022, they have launched an initiative called Agri-Tech Egypt, where they're providing capital to startups that are coming up with innovative technology that boost up agriculture practices in the countries that are safe and sustainable. Third, cross-sectoral and multi-level collaborations, not just at the national level, but as well at the city level, involving several sectors. It's quite impressive to have the Minister of Environment, Minister of Health, and Minister of Agriculture in one conference, but we'd also like to invite the other sectors, including the sector for international development, finance, and education. Last but not least, we need to talk about the money, increasing investment and directing financial flow towards healthy and sustainable food systems, and providing the right financial capitals for people, for the consumers, in order to be able to afford the healthy diets. I'll stop there and happy to answer any follow-up questions. Thank you.
شكرا جزيلا دكتورة لوجين على هذه المداخلة القيمة التي تعرضتم من خلالها إلى دور الأمن الغذائي وسلامة الأغذية في تعزيز الصحة العامة وأهمية تبني أنظمة غذائية مستدامة تدعم الصحة البيئية والإنسانية. فشكرا جزيلا لكم. سوف لن ألقي سؤال أيضا ونمر مباشرة للمداخلة الرابعة التي سوف يقدمها لنا الدكتور محمد الغربي، وهي الصحة البيئية في منطقة الشرق الأوسط وشمال أفريقيا، تأثير تغير المناخ وتدهور البيئة على الصحة. طبعا الدكتور محمد الغربي هو أستاذ علم الطفيليات البيطرية بالمدرسة الوطنية للطب البيطري بسيدي ثابت بتونس، وهو حاصل على شهادة الماجستير في البيولوجيا الجزيئية من كلية العلوم بتونس، وعلى درجة الدكتوراه من المعهد الوطني المتعدد التقنيات بتولوز فرنسا. لكم الكلمة الدكتور محمد. شكرا.
شكرا جزيلا. بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله. Thank you for the invitation. For the very first time of its history, Earth is being destroyed, and it is destroyed by just one species. This species, you know, is, of course, humans. Sorry. So, the first form of life in Earth was the constitution of what we call prebiotic soup, and it was something like 3 billion years ago. The human population, since just only 50 years, has more than doubled in Earth, and we are more now than 7 billion persons, and you see in this graph, which is dramatic, you see the number of mammals, and you compare it with the number of wild animals, and you understand that livestock is representing the majority of this biomass in Earth. And they are laughing. What is shocking for human population is that we are still using a very, very old definition of Earth. This definition was established since 1947. And a group of scientists now are suggesting a new definition in order to take in consideration the One Earth dimension. You see here the MENA, and I was waiting during this conference so that one person define what is the MENA region, because we have several definitions of this region. And what could be said is that it's a very huge region, and just, okay, very good. You see that it's a very large region. Morocco is something like, the area of Morocco is something like 1.5 million kilometers. Algeria is 2.3 million kilometers. Tunisia is 166,000 kilometers. Libya is 1.7 kilometers square. Egypt is 1 million kilometers, and if you consider after that, KSA is 2.3 million kilometers. Just to give you an idea, in order to understand the dimension of MENA region, the Mediterranean Sea is 2.5 square kilometers. So you understand it's a huge region. And this region is in the proximity of Europe, since it is related just with Europe through the Strait of Gibraltar, which is something like 15 kilometers width, and in the other side with Dardanelles and Bosphorus straits, which are something like 1 kilometer straight. So you understand that, and in the middle we have Tunisia, which is just only 145 kilometers far from Italy. So we are really numbers with Europe, and this is very important to consider for the epidemiological patterns of different diseases, and basically for, yes? Of course. Sorry for that. I picked up this map, and I don't recognize Israel as a country. I recognize just only Palestine. And sorry for that. I apologize for that. Sorry. There is no country which is called Israel. We respect Jewish, of course. They are our neighbors. They are our friends, they are our, let's say, colleagues, but there is no Israel. Sorry for that. If you PubMed, just only 3 words, which are global warming and health, you will see that in PubMed you have an increase, a dramatic increase of the number of published papers about this subject. It means that there is really a sort of, a sort of recognition of the importance of this global warming in the world. And if we speak about the climate change and its impact on Earth, you see in this slide that there are several impacts and which were classified, explained, and a lot of papers are speaking about these impacts. Okay. And if you look to this table for the MENA region, you see that you have millions and millions of clinical cases of different neglected tropical diseases. And if you make just a small statistics about these diseases, you will see that parasites you have from this list, 10 diseases are due to parasites, 14 are zoonotic diseases, 8 are vector-borne diseases, and 4 are parasite vector-borne diseases. So you understand that we have the same epidemiological pattern in the MENA region. Just to show you, I'm going to take some examples from Tunisia because this is the country that I know the most, of course, because I'm from Tunisia. And here you have the map of different rivers in Tunisia. We have just only one river which is permanent. It is the river of Megerda, which is something like 340 kilometers long. And this river is they have built a lot of dams on this river in order to try to, of course, save water. Because of drought, and you know that we have get several episodes of drought here in Tunisia, basically in 2023. But also, as you know, this is the problem of climatic change. It's not just only the drought, but variation of pluviometry. We get also floods on Megerda here. It was in 2012, and the Mjez el-Bab region. And the government in Tunisia decided to interconnect different dams in order to distribute water to different regions. And you see here in red the interconnection of different dams in order to save water, of course, but also to preserve Tunisia from floods, of course. And these interconnections led to the spread of snails, which are the intermediate host of flukes, which are Fasciola hepatica, and Fasciola hepatica is endemic in Tunisia. And this parasite now is present roughly in the whole country. You see that it is a parasite which is present in the MENA region also. Unfortunately, in Libya, there is a lack of epidemiological information. But this parasite is zoonotic, and it is causing high losses in cattle also. Another example of the impacts of climate change is Toxoplasma gondii, which is a protozoan. And you know certainly that 1/3 of the human population is infected by Toxoplasma gondii. So you understand that in this room, we have 1/3 roughly of the persons who are certainly positive. Okay. So here you have the cycle. I'm going to just to go quickly. Just to show you, here you have the different hosts, and the floods are going to cause the spread of oocysts in the environment, and they could be also adsorbed to oysters, for example, and you know that oysters are eaten raw, so people could be contaminated by oysters, and in the gills also of fish. And if these fish are eaten by cetaceans, they will be also contaminated. And as you can understand, Toxoplasma gondii is not a normal parasite of cetaceans. And in cetaceans, it will cause neurotoxoplasmosis with fatality cases in these animals. Earthworms are very important. If you use a lot of medicines, ivermectins, for example, you are going to kill them, and they are very important because they are what we call pathogenic hosts, means that they are going to dilute the concentration of parasites and basically of Toxoplasma gondii or so. And the parasite is now present in camels, and something like half of the camels in Medellin region are seropositive, and this seropositivity is due to the presence of the parasite in wild cats, which are also endangered according to the list of IUCN. You have here the list of carnivora in Tunisia, and you see that the number of species is very low, and all of them are endangered according to IUCN, and some were extended also from Tunisia, unfortunately. I'm just going to show you a couple of slides about Leishmania to show you that the imbalance of ecological systems are badly influencing, of course, you know, the epidemiology of the diseases. You see here that if you have drought, if you have foods, which is used, unfortunately, in Tunisia, if you have habitat destruction, habitat fragmentation, and human and dog harassment of wild dogs, wild carnivores, sorry, you will have a decline of rodent predators, and this will cause an increase of rodents. I'm speaking about different rodents which are reservoirs of Leishmania, and these rodents have our strategy, and they have a high density if you compare it to the case strategy of carnivores, white carnivores. With the low density, you have to imagine that the density of white carnivores is something like 1 animal per square kilometer. So you understand that there is a thrive of different rodents, which is going to induce an increase of the incidence of these diseases. So they have, in Tunisia, they have, during the 80s, suggested to plow the vicinity of the villages. It was effective for just a couple of years, and after that there is, you understand, an increase or an establishment of the rodent population. The use of insecticide is not efficient also. On the other hand, and this is very important to know, you have also what we call coprophagous insects, which are going to eat these scats, and this will dilute, of course, the scats, leading to the destruction of the eggs of sandflies. On the other hand, you have ecotone destructions in several places, and you know that the ecotones are very important. They are very rich in biodiversity, and riparian species are destroyed in Tunisia and also in the MENA region, leading to the increase of sandflies population, which is going to increase the capacity, the vector capacity of these species, leading to the increase of incidence of leishmaniasis in humans, and of course in dogs also. Just, I will finish with this slide. You know that a lot of migratory birds are flying from Africa to Europe and Asia, and they have flyways, of course, traditional flyways. But when there is habitat destruction, habitat disturbance, pollution, these animals are going to change their flyways. When changing their flyways, they are going to introduce to be in new ecosystems, introducing new ticks, but also they are going to introduce new tick-borne diseases. And you understand that this will be function in the sense from Eurasia, from Africa to Europe, but in the other sense also, because we have, for example, in Tunisia, but also in Algeria and in Morocco, a new species of Ixodes, which is called Ixodes unopinatus, which was confused to 2015 with Ixodes sissonis, and you understand that all these cryptic species are very important to know in order to understand and to better our knowledge on epidemiological diseases and basically on ticks and tick-borne diseases, which are now very, very important, as you can guess. I will stop here, otherwise I will. So just a conclusion, okay? Just a conclusion to say that pay attention, because people will make a confusion between one medicine and one health, and this is a confusion which is very frequent. I sent my paper, which was published in 2025, to my colleague, and I said to him, I'm very happy to share with you a paper about one medicine, and he read the paper and he said, Mohammed, your paper is very good, but it's one medicine, it's not one health, because I forget to speak about the environment. And so pay attention for that. This is very important. And also, I would like to say one word about this story of, high level, this is very bad because I think that this is not inclusive. And if you would like to practice, to put in field, One Health paradigm, you need the triptych, of course, but you need also to have an inclusive, strategy, which is involving, different specialties, interdisciplinary, scientific people. So the word, I don't like this word, high level, because you are going to push some people from, nurses, PVPs, technicians, are going to, you are transmitting a message, you are not involved, you are out of, So another point, and I will finish with this slide, sorry for being very long maybe. Early education on One Health. If you take doctors, if you take, vets, and you learn them in the faculty about One Health, I think that it's too late. We have to explain for our young generation the importance of the environment, the importance and the impact of environment, and the impact of the health of the environment on different health. And just imagine in Tunisia, we have 0 magazines which deal with the nature, environment, zoology, etc. There's no magazines about that. And I looked yesterday to my library in order to see how many Tunisian books are dealing with the environment and with the zoology. And I found just one book about the plants in Tunisia. I have 3 books about zoology, and that's it. There are no books on zoology in Tunisia. And with this strategy, with this neglected aspect, the health of the environment, which is one of the pillars of the triptych, of course, we are not going to succeed on our actions. Thank you very much, and sorry for being very, very long. Thank you.
شكرا جزيلا دكتور محمد على هذه المداخلة الأنيقة والشيقة والثرية جدا بالمعلومات والتي تعرضتم من خلالها إلى تأثيرات التغير المناخي وتدهور البيئة على صحة الإنسان والحيوان وأهمية إدراج الصحة البيئية ضمن استراتيجية الصحة الواحدة. ولكن قبل أن أنهي اسمحوا لي أن أستغل درايتكم الكبيرة في هذا الموضوع وأسألكم هل تعتقدون أن الأنظمة الصحية الحالية بمنطقة الشرق الأوسط وشمال أفريقيا تملك الجاهزية الكافية للتعامل مع الأوبئة والمخاطر المرتبطة بالمناخ؟
شكرا على السؤال. رغم حبي للغة العربية لغة القرآن سأجيب بالفرنسية لأني أستعمل العربية أكثر لقراءة القرآن أكثر منه لدراساتي العلمية. Merci pour la question très intéressante. Moi, je pense, bien évidemment, je n'ai pas beaucoup de connaissances sur ce qui se passe dans la région MENA, en fait. Mais d'après ma connaissance, d'après ma culture générale sur les différents systèmes de santé, qu'ils soient animaux ou les systèmes de santé en médecine humaine, ce que j'ai remarqué, c'est que la région MENA va à des vitesses qui sont très différentes. C'est-à-dire que si on regarde ce qui se passe dans différents pays, vous allez voir que il y a des secteurs où certains pays sont très développés, et puis il y a d'autres secteurs où malheureusement le développement est encore à espérer, à attendre. Moi, je pense que en ce qui concerne tout ce qui est une seule santé, c'est-à-dire si vous prenez la santé de l'homme, la santé des animaux, la région MENA est vraiment très bien équipée. Il y a des facultés de médecine, des écoles vétérinaires qui injectent, entre guillemets, c'est pas péjoratif, des scientifiques de très haut niveau. Mais le problème qui se pose, et ça c'est peut-être le bémol de la région MENA, c'est les aspects environnementaux, que ce soit la zoologie, l'écologie, la biologie végétale, la botanique. Je pense qu'il y a un problème par rapport à ces aspects-là, et c'est cette composante-là du triptyque, bien évidemment, des 3 santé qui méritent d'être encore développées pour essayer tout d'abord d'inculquer aux nouvelles générations un amour, une compréhension, un respect de tout ce qui est environnemental, de l'être vivant d'une manière générale, de l'être vivant, qu'il soit végétal ou animal, un amour de la nature. Et vous voyez que assez souvent, les enfants maintenant sont totalement déconnectés de l'environnement, ce qui est malheureux et ce qui est dommage. Et on ne peut pas, moi je suis convaincu qu'on ne peut pas changer. En tout cas, il est très difficile de changer la mentalité, changer la perception des gens à 20 ans, à 23 ans, lorsqu'ils ont eu leur bac, lorsqu'ils commencent leurs études. Et il y a un autre problème qui se pose dans la région MENA, c'est que prenez un médecin, Il connaît les mécanismes d'action des différentes molécules, la pathogénie, l'anatomie, c'est extraordinaire. Je dis que c'est très intéressant, mais il n'a reçu aucun cours sur la zoologie, aucun cours sur l'écologie. C'est la même chose aussi pour le vétérinaire, hein, c'est la même réalité aussi. Et je trouve ça anormal parce qu'un médecin ou un médecin vétérinaire ne peut pas traiter un sujet, qu'il soit humain ou animal, totalement déconnecté de son environnement. Parfois, l'environnement est très important. Et j'invite ici à réfléchir sur ce point-là qui est, à mon avis, très important. Merci.
شكرا سي محمد. كلمه ليك باش تختم في ثواني كان ممكن. احنا عندنا مشكل لوجستي، عندنا الناس تاخذ طياراتها بعد 2.5 ساعات.
مع تجديد الشكر لكل
في الميكرو يمشي.
مع تجديد الشكر لكل المحاضرين، شكرا للحضور الكريم، مع تهانينا للجهة المنظمة بنجاح هذا المؤتمر. شكرا
سي محمد الرابحي، تحية لهم الكل. نواصل إذن الآن مع الدكتورة سينا حاج عمر. Launching of the MENA One Health Community of Practice، إعلان مهم. والدكتورة سينا حاج عمر اللي هي مديرة التعاون الدولي بوزارة الصحة التونسية. الكلمة لك.
Thank you so much. Good morning, everyone. It's an honor to be with you today among my colleagues, our partners, united by a shared vision, one health, one future. Working together, it's not an option, it's essential. Now, I know what you're thinking, not another online platform. Yes, we have all joined groups where no one ever posts, but this one is different. It's a space to connect, to contribute, to inspire, and actually follow up. Next slide.
عندك clicker?
Okay, so what's this community of practice really about? At its core, it's built around 4 big goals. First one, knowledge exchange, a space where One Health practitioners from across the MENA region and North Africa can actually share what works, what don't, and what they wish someone had told them sooner, from research to real-life lessons. Second, networking, a space where we're talking about genuine connections, human health, animal health, environmental, and all talking to each other and caring about each other. Third one, capacity building. We're talking because we all have something to learn, whether it's workshop, training opportunity, or a new way to look at an old problem. We're making space for growth. And fourth, advocacy, creating voices for One Health, not just among ourselves, but with the public too. Because if we don't tell the story, someone else will do it. And they probably won't get the science right. The big picture, a vibrant, self-sustaining network that's not just talking, it's doing, driving innovation, creating impact, and maybe even having a little fun along the way while saving lives. Now, you might be wondering, who exactly is this community for? The answer is simple. It's for you. Whether you're a public health expert, a vet, environmental scientist, policymaker, researcher, student, or someone working in a community-based organization, you have place in this space. We're opening the doors wide to individuals, institutions, ministries, universities, NGOs, international agencies, anyone who shares a passion to One Health in the MENA region. Where is the magic happening? We are keeping it simple and professional. LinkedIn, the only platform where being online actually looks productive. Our community of practice already has nearly 600 members in a private group where you can post, share, or just quietly follow along. No pressure. You'll find thematic discussions for zoonosis to AMR and climate change, plus event updates and the shared library and resources you'll wish you had sooner. In short, it's LinkedIn, but smarter, focused, and built for One Health professionals like you and us. So, what we'll actually do together in this community of practice? We've mapped out a set of proposed activities designed to keep the momentum going and the community active, useful, and inspiring. Think of things like monthly thematic discussions, expert webinars, and virtual roundtables to learn directly from those leading the charge. Spotlight posts to highlight your work, your challenges, and your solutions. And of course, resource exchanges and curated content tailored to the needs of our region. These activities are just starting points, and we want you to help shape, and come next. After all, it's not just platform, it's your community. Finally, what we are doing next. First up, stakeholders engagement. We're reaching out to potential members and partners. Then there's the governance structure. We are considering forming an advisory board and recruiting moderators. So, if you are a type who enjoys shaping strategy and occasionally reminding people to be nice in the comments, this might be your moment. We'll also be drafting community guidelines. Nothing scary, just a few common sense rules to keep things respectful, relevant, and rooted in facts. And the best part, the LinkedIn page is already live with 595 members and growing. That means you can join today, post something smart tomorrow, and pretend you've been here since day one. So let's roll up our sleeves, build together, and make this community of practice vibrant, valuable space for everyone. The LinkedIn page is already live. Just join us to connect, contribute, and keep the momentum going. Let's take the community for connection to action. One Health deserves one strong, united voices across the region. Thank you for listening.
Thank you, Dr. Sina Hajamor. So now it's time for a short, actually a very, very short. It's already programmed for 10 minutes if you look at your program, for a very short coffee break. Can you be here in 10 minutes? Do you think it's possible? Please don't go to the airport straight from the coffee break. We still want to go to the end of our program. We have 2 more panels, so please join us in 10 minutes. It's very quick. After, we're going to have lunch for networking, so let's try to stick to the program and take all your time later during lunch. But for the break, it's really a short break. المفروض كنا كملنا البانل الثاني، احنا الان مش نبداو بالبانل الاول بعد البريك، فعندنا تقريبا ساعة و5 دقائق تأخير. مش الناس تنجم تبرمج، ولكن مش نحاولوا نتحكموا في هذايا بمساعدة المودريتورز والباناليست إن شاء الله. الندوة الجاية Building up the immunity, a dialogue on vaccines, vaccination and cold chains in the One Health era. Dr. Maria Elena Bottazi, Senior Associate Dean, National School of Tropical Medicine and Co-Director, Baylor College of Medicine, USA. Thank you for joining us. والدكتورة يسر علوش Head of Office International Institute of Refrigeration. نحب مش كانت تنجم تكون أي جنسية مش خاطرها تونسية، احنا فخورين بها أكيد في تونس، هي قصة نجاح كبيرة. ترأسها للانستيتيوت عدت بانتخابات صعبة جدا، وفي الآخر احنا نقول فرنسي أولما، يعني ربحت وفازت قدام المنافس نتاعها من دولة أوروبية شقيقة بفارق تقريبا 30 صوت، معناتها حبينا نصفقوا عليها، احنا فخورين بها. يظهر لي عندك بانيل من احسن ما فما. الدكتور هاشمي الوزير الكلمه ليك. الاستاذ هاشمي الوزير.
Okay, so I'm very happy to moderate this session entitled "Building the Immunity." You know, building the immunity, it means, in other words, how to develop the immunity against the pathogens in general. You have seen the list yesterday, today, and there are new ones that will emerge in the future. So it's important to have some strategy and some idea on vaccination, because it's different from vaccine development. Vaccination, it involves all the logistical aspects, etc. So vaccination, despite its scientific and industrial potential, the region, I'm speaking about the MENA region, remain heavily dependent on imported vaccine, as local researcher development and production capacity remain unfortunately limited. Vaccination is about more than just the availability of vaccine. It encompasses a complex logistic system where the cold chain play a critical role, particularly in rural area, conflicted zones, and regions exposed to extreme temperature. The lack of adequate infrastructure and innovative solutions such as solar power refrigerators or smart temperature monitoring device, etc. It impacts the effectiveness of immunization campaign. Okay, for this and to help reflect of these critical topics, we are honored to welcome two outstanding speakers, each bringing a complementary perspective of this discussion. We will start with Dr. Maria Elena Bottazi. She is a world-renowned scientist and co-director of the Texas Children's Hospital Center for Vaccine Development, affiliated with Baylor College of Medicine. Together with her team include Peter Hotez, who is the co-director of the centers. She champions goal vaccine equity, focusing on the development of low-cost, accessible vaccine for low and middle-income countries. Long before the COVID-19 pandemic, her center, because they were involved in COVID-19 vaccine development and tech transfer to some countries. But long before this, her center was actively engaged in developing vaccine for neglected tropical disease, many of which are zoonose prioritized in One Health strategy. One of their key missions is to facilitate technology transfer to vaccine manufacturers on the global south. Their commitment on One Health is strategic and cross-cutting, placing human health in close alignment with animal and environmental health. So, Dr. Bottazi, I invite you to share your experience and your vision and your recommendation for the MENA region, particularly around the central question how we can break down barriers to enable collaborative vaccine development for stronger One Health resilience. Thank you.
Thank you very much. Good afternoon, good evening. Your Excellencies, the government of Tunisia and colleagues, it's just a pleasure to be here. So I'm here to give you the Texas experience. As you'll know from the saying, everything is big in Texas. So I will tell you a little bit of what we are doing to position vaccinations, taking into consideration of cold chains in the One Health era. So where do I come from? I actually come from Houston, which is, of course, one of the largest cities in the United States. In fact, we are the third largest city after New York and Los Angeles. Sometimes Chicago and Houston kind of take the third place. But it's a very unique part of the world. It's the third coast of the United States, and it shares its borders with, of course, Latin America. We are a gateway, certainly, to Central and the Caribbean, and Europe, Asia, Middle East, and certainly Africa, too. But Houston, as a fastest growing city, it has also a pretty massive port, very diverse urban areas, and it's really a trade of all kinds, but at the same time, therefore, we're really hit with a lot of extreme weather events, as well as plagued by many of the tropical infectious diseases. And I have to thank Dr. Luzier for bringing vaccines and vaccinations to the table of the discussion today, as well as we heard a little bit from Dr. Mohammed earlier, the neglected tropical disease and how this sets a stage for the MENA region. So, as I said, everything is really big in Texas. So in Houston, not only we have an ecosystem of oil and energy and also aerospace with NASA, but we also are the home of the largest medical health sciences, life sciences ecosystem. The Texas Medical Center only has a footprint of around the same as downtown Los Angeles. It's 61 medical institutions with approximately 150,000 people that come in and out every day to work. I am affiliated within this Texas Medical Center with two institutions. One is an academic institution, which is Health Sciences University, Baylor College of Medicine. And we have a very tight alliance with the largest children's hospital, which is Texas Children's Hospital, where we actually forge 4 missions, academic missions, education, research, clinical practice, and access to society and service. So when we first moved to Texas, we actually have been there 15 years now. We came from the Washington, D.C. area, originally localized within the George Washington University, but we came down to Texas because we really wanted to up our game to try to uncover the burden of neglected tropical diseases, not only in Texas, but also the Gulf region. And if you look at some of the data, we definitely have been able to find a whole epicenter of neglected and infectious diseases. As you can see, we have West Nile virus, we have leishmaniasis, we have Chagas disease, dengue, murine typhus, a series of other diseases like Zika, chikungunya, even hookworm we found, and which, as you can see, has a lot of parallelisms with the MENA region and pretty much a lot of the areas of the world. We actually just recently did a summary of the first 10 years of our clinical practice findings. We have not only an adult tropical medicine clinic, but we also have a pediatric tropical medicine clinic. And as you can see, we really have an array of parasitic, bacterial, viral, fungal diseases that we see. Most of them, of course, are not only through the migration and immigration, but also they are transmitted locally. In order for us to really address this, I think as we've been hearing throughout the presentations yesterday and even today, we're really trying to understand by certainly doing very swift detection and early systems to be able to rapidly have an action and decide to develop new interventions. So we actually recently, this year, got awarded the Hill Philanthropies Prize in order to set what we are calling the Parasite Atlas and the Virus Sphere of the state of Texas and the Gulf using a metagenomics approach, which is, I think, very similar to what you've been hearing. We combine not only wastewater management, we evaluate what we can find in the different vectors, mosquitoes, ticks. We also evaluate soil samples. And then we generally interact with, of course, all the public health agencies within the state. But more importantly, what we're trying to do is to really create a knowledge for us to then decide what kind of strategies we should approach to develop, of course, preventive interventions, which are, of course, vaccines, and also improve a little bit the diagnostics. So within the ecosystem of the Baylor College of Medicine and the School of Tropical Medicine, which is primarily where we do our educational initiatives by training the next generation of scientists and physicians, with the Alliance of Texas Children's, we created the Center for Vaccine Development, which really has a sustainable One Health roadmap to try to develop low-cost, affordable solutions. And as you can see, what we do is we use a product development partnership model. This is a model that was actually launched around 25 years ago, where it uses business practices, biotechnology, pharmaceutical business practices, but to advance activities in the nonprofit sector through alliances and partnerships. We also have been quite keen to select the appropriate vaccine platforms. We currently have recombinant platforms. We also have been dabbling on mRNA technologies, and I think one of the uniqueness that we do is we do a lot of formulation science. But I think one of the things that we enable equity is because we're very intentional and very creative, not only with how we advance the science, but also how we do our intellectual property and management practices. We are primarily non-exclusive. We very rarely have patents, so we basically have all our technologies open, and that's the anchor is to really be open science. I'm going to spotlight a little bit our experience of our COVID-19 technology, which actually you will see that it all actually was born in the MENA region, and which now we have distributed more than 100 million doses in India and in Indonesia. And then I'll give you a little bit of a snapshot of what we're doing with one of our vaccines called anti-anemia vaccine, which is a human hookworm vaccine, and some of the practices that we're using. So why are we interested in the MENA region? In fact, we started working on coronavirus research when, after SARS, the coronaviruses became a little bit neglected. It was pre-MERS, post-SARS, pre-MERS. In fact, our National Institutes of Health at that time, in 2010, awarded us a fund to try to move a SARS technology from the basic sciences into clinical and through production and clinical testing. While we were advancing the SARS vaccine, of course, then we got hit with the MERS, which coincided with when my co-partner in science, Dr. Peter Hotez, was actually appointed by the Obama administration as a US envoy. He actually was assigned the MENA region. So he was here, in fact, hosted by Dr. Luzier in Tunisia. He also visited Morocco, and then he visited the Kingdom of Saudi Arabia. We actually had an amazing project in the kingdom where we set up not only a memorandum of understanding, but also a research collaborative agreement, which with them, we tried to build capacity within King Saud University, where we started training some of their physician scientists, PhD scientists. And an example in one of the photos is Dr. Al-Mutairi, who's now leading as part of the 2030 initiative in the kingdom by directing the R&D in a company called Vaccine Company Pharmaceuticals, I think it's called. Because we learned through the experiences in the MENA region, especially being what I call the 5th C, which is cultural intelligence, we understood the needs of how to develop vaccines that would likely be amenable for use in majority Muslim countries. And that meant that we had to understand the processes of halal readiness. In fact, when we then transitioned our COVID-19 technology, we already had set up in our laboratories all the documentation practices to be able to document, of course, all the raw materials and the fact that there is no animal-derived products in our technologies. And when we collaborated with Biopharma in Indonesia, they were able to achieve not only the tech transfer of our technology, but work with their ministries to provide halal certification to Indovac, which is one of our COVID-19 technologies. And then, of course, with Biological E, one of the probably the 3rd largest vaccine manufacturer in India, we transitioned Corbevax, which it's probably the one that got the most news. So just a few pearls of wisdom of why we think we were successful in doing what we did. So first of all, I think we recognize that being embedded in an academic health sciences system linked to a children's hospital enabled us to be very creative academically, scientifically, but we also led to a paradigm shift, which I'll tell you in a moment what it was. But at the same time, being a product development partnership, we really had to learn the business of vaccine development, meaning how do you not only establish value propositions, but the cost economic models to advance a vaccine. The third lesson, which I think is actually one of the most important, is we really had to train ourselves in regulatory science. It's not the same in academia to do research compared to regulatory enabling research. Research that then can be fed into the dossiers of regulatory agencies that then support seamless, high quality, robust research for production, of course, eventually clinical grade materials. Partnerships were essential, right? We were very intentional of who we partner with, how we partner, and it's not just a one-way partnership. In fact, when we partnered with Biopharma and with Biological E, it was really a co-development partnership, meaning we just didn't hand them over the technology. We worked with them to learn how to develop, from a very early research process, 10-liter scales, for example, to thousands of liters of scales of vaccine production. We've heard a little bit about science engagement, which is essential. So we had to bring to the civil society doing demand forecasting and other assessments to be able to deliver eventually the vaccinations. And we were actually very intentional with our funding. To give you an example, in Texas, of course, as you know, the King ranches, the big cattle ranchers are very keen, of course, to support the health not only of their cattle and their agriculture, but also certainly the human. And so they were, for example, one of our funders. I have other examples if you're interested. But I think the key for us was in the partnership area is that we were very intentional at partnering with who would be our development partner for the vaccines. There is an enormous network of what they call the Developing Country Vaccine Manufacturing Network, which you can see, which before the COVID-19, maybe they were not really considered their own first-rate innovators. They're actually mostly known because they're follow-on producers. What does that mean? It means that someone like a Merck, a GSK, even an AstraZeneca now, a Moderna, they hand over a very mature technology and they produce it for them as a contractor. They stamp it with the original brand of the original pharma company, but they're not really innovating indigenously and not creating self-reliance and self-sufficiency. I think COVID-19 changed that paradigm. I think our technology also is an example of how we changed that paradigm by giving them a very rough R&D technology from the lab, and they were able, Biological E and Biopharma, to be first-rate innovators. And now I think if you actually hear, we know that the DCVMNs have like really raised to really fill that gap of self-sufficiency and self-reliance in different regions. I think you have aspirations that certainly in the MENA region, you can play a role in this sector. I'm going to just very rapidly tell you some trends that we see now in vaccine development. I actually just came back from the Global Vaccine Innovation Research Forum, and there are 6 things that I think it's essential moving forward. Certainly scientifically, as you know, RNA technology has a keen interest, especially with the establishment of the WHO mRNA hubs, which of course has a big hub in South Africa and the rest of the world. Recombinant proteins, as well as other types of technologies, still remain important because they are affordable, accessible, and scalable. There are new ways of how to do innovative clinical designs, for example, using control human infection models that really de-risk having to invest a lot in phase 2, phase 3 clinical trials by doing them in a controlled fashion in a lab. We've spoke all this conference about the role of artificial intelligence, especially to better target, identify, and innovate clinical trials. And don't forget that also we're looking at a dynamic field of personalized and tailor-made vaccines that now are also going to be used as host-directed therapies. I mentioned already to you the role of manufacturers in the developing countries. Combination vaccines is the new trend in WHO now. They're creating a new framework. And in that framework, they really base their decisions in what they call multi-criteria decision processes, which is what eventually builds the case for policies. We also have learned that it's important to bring in the cost economics assessments. And also, as you know, with the aspiration of sustainability, we really have to focus on renewable energy, green chemistry principles, etc., including the cold chain, which we'll hear shortly. So just a brief example of how then we're adapting these new trends. We've heard a little bit about food insecurity. We've heard a little bit about the burden that we have on malnutrition. But malnutrition and anemia is also driven by infectious diseases, especially through the latest anemia burden studies. We've seen that malaria, hookworm, any blood-feeding parasite really contributes to this. Malaria and hookworm are co-endemic, especially in the continent of Africa. You see that by co-infections, you have very severe anemia, especially in children and in women of childbearing age. And these are very thermal-resistant parasites. Therefore, climate change is really having a benefit for these parasites. So what we've been doing is we have applied an anti-anemia vaccine strategy where we have identified a candidate. I don't have time to tell you a little bit about the candidate, but it's one of these molecules that the parasite uses to detoxify the heme after it degrades the hemoglobin. So we're trying to starve the worm to death. And by doing some studies, including one of these control human infection studies, we now have been able to prove that one of our formulation strategies gave us 100% protection. The idea now is to really look at how we can combine the hookworm vaccine with a malaria combo vaccine. We also are, of course, looking at how we can do this as a standalone vaccine. There's some possibilities, not only in middle-income countries and maybe even in the US for the travel or military market. But I think that that combination of combining it with malaria has had some real traction with some of the stakeholders, including some of the vaccine manufacturers. And in parallel, we're also innovating with some of the RNA technologies to give opportunities, for example, with the WHO African hub. So ultimately, I think for us, clearly we see that the MENA region has an amazing untapped potential. But as you know, with challenges, you have to be able to have the supply inputs and the manufacturing capabilities or enablement. You have to have the people, the knowledge, and certainly the materials. Standardization is, of course, of key essential. The regulatory enablement, including quality control and quality management systems, are essential. And of course, the political will and certainly the incentives. So we are definitely open for partnerships, collaborations, and funding opportunities. And I'll leave you there with thanking you. And ultimately, I think the anchor of everything is science diplomacy, especially vaccine diplomacy, where you really have to use that triangle of diplomacy. Thank you so much.
Thank you very much, Dr. Boutazzi. Very interesting, and the message is clear. We are here, and we can see, and we can help and be in connection with the different MENA countries for vaccine development, if any. Thank you very much. So now we will move to the second presentation. It will be on cold chain, and especially in fact in refrigeration. It will be given by Dr. Engineer Yusra Alouche. Yusra Alouche is mechanical engineering from the University of Porto and has over 15 years of experience in the refrigeration sector, which is a field a little bit different from what we saw yesterday and today, but refrigeration is extremely important.
Fundamental.
Animal health, okay. She stood out as a research scientist in refrigeration technology at the Norwegian University of Science and Technology, where she was also serving an associate professor in refrigeration technologies. Dr. Alouche has authored an impressive number of publications in high impact factor scientific journal, scientific guides and reports, elected as Director General of the International Institute of Refrigeration during the 26th International Congress in August 2023. She officially assumed office October last year, in fact, in 2024. Congratulations.
Thank you.
Dr. Alouche is committed to advancing sustainable and climate-friendly refrigeration technology while reinforcing the role of science in policymaker and industrial innovation. A key priority for the mandate is to also support strengthening international cooperation by building bridge between countries, institutions, and stakeholders to foster knowledge exchange on refrigeration, capacity building, and inclusive access to refrigeration solutions. We think that this point is very important for One Health aspect for our region because of the hot climate, because of all the product, vaccine, drugs, etc., and foods. I hope that Dr. Alouche will give us more, let's say, information on the importance of cold refrigeration in the field of One Health. Thank you very much.
Thank you so much, and thank you again for the recognition. I'm very glad to receive the recognition from my country. Also, would like to say that if I'm today occupying a high-level role, is also thanks to the high-quality education I have received from my country. So, High Excellency Mostapha Ferjeni, Excellencies from MENA region, dear participants, Aslema. Before I start my presentation, I would like to commend the Tunisian government efforts for hosting this Nobel Summit, the One Health Summit, which brings together a variety of stakeholders discussing human, animal, and environmental health. My sincere thanks also and appreciations goes to His Excellency Mostapha Ferjeni and his dedicated team at the Ministry of Health for the high quality arrangements, but also for the seamless organization. And last but not the least, Professor Louzir,
This is a special thanks for you as the head of the scientific committee for recognizing the fundamental role of refrigeration in cold chains as a critical infrastructure for societies in climate sustainability. And as you said, it's a different topic, but it's also another answer to the colleague in the last session, who emphasized that problems are from humans, but also humans provide with technologies to tackle these different issues. So today I'm speaking about the critical yet underappreciated pillar of our modern life. It's refrigeration in cold chains. It's a cross-cutting sector which is essential for the economic development, food safety, health safety. So today we cannot speak about food safety, food security without speaking about cold chains. We cannot speak about the health utility, security, and safety without speaking about cold chains. This is an important message that I would like to convey. So refrigeration cold chains are not just the technologies. It may appear very complicated for you, but it is very useful, believe me, and I'm going to show some numbers on that. It's a foundational to our societies and also critical in fighting climate change. And this is why it is a very relevant topic to discuss at One Health Summit. So the IIR, the International Institute of Refrigeration, it's more than an institute, it's an intergovernmental organization. We are the World Organization for the Development of Refrigeration. Tunisia is a member country since early 60s. Our country, Tunisia is a visionary country, and at that time, since that time, the government, Tunisia has understood the critical role of refrigeration to reduce the food loss and make it available to feed the population. It's not only the case for Tunisia. You can see how many countries are joining or have joined the organization since it was founded in 1908. So about 60 member countries. So what we are doing, we are developing, disseminating information, scientific information about refrigeration technologies, making it available to our network and beyond the net and beyond the boundaries of the membership, of course. We do run scientific and international conferences, and we maintain one of the most comprehensive refrigeration database. We need to recognize today that there is a problem with the data gaps and the lack of accessibility of the data. So our work supports policy, innovation, and collaboration, as Professor Louzir said. So refrigeration touches nearly every aspect of modern life, from ultra-low temperatures for vaccine and medical treatments to keeping our homes cool and our food safe. It's essential for healthcare, agriculture, data centers. Now we are speaking about data centers and technology. If you are able to share messages, WhatsApp, to consult ChatGPT to facilitate our life, this is because we are using also refrigeration. Regarding the data center, about 40% of the electricity consumption goes to cooling of the data center. Otherwise, it's not working. So important also to mention that. Next slide. Agree, we are in a dual crisis, climate and humanitarian. Temperatures, as you could see, are rising, historical records, beyond the historical records. Billions are lacking access to sufficient food. 12% of the food is lost due to cold chain failure, which can feed up to 950 million people in the world. And these are the research of our organization, which is scientifically based. And this is an information for you, Rabia, from the World Bank. You were looking at data just earlier. So while 1.5 million people are dying each year from the vaccine-preventable disease, 1.5 million, 20% of pharma products are damaged due to improper storage. So these are terrifying numbers. And if we would like, at the One Health era, to tackle all these topics, we need to speak refrigeration cold chains, because the solutions are there. The technology is ready. So it's just about integrating it in the policies and applying it, as simple as that. So this takes me to say that refrigeration today is should not be considered as a luxury. Unfortunately, in our countries, it is considered as it is. It is a matter of survival and equity. So these slides drive home to the point that cold chains are essential as roads and electricity. Without them, we cannot deliver the vaccines, reduce food loss, or protect the most vulnerable. It's an infrastructure that saves lives and feeds the world. Okay, it may be too technical, but I promise I'm going to keep it very simple. This is a simplified refrigeration cycle, but you can see in the corner, it is much, much more complex than it is there. It's based on a few components: a compressor, a condenser, an evaporator, and an expansion device. So these are the main components. And it has a blood. It has a heat transfer fluid, which is running through all these components and taking heat, removing heat, thanks to the phase change of this refrigerant, and taking it from one medium, extracting, and then throwing it away. And this is how we create cold. Cold doesn't exist, we create it mechanically, yeah? And this blood, I'm trying to speak your medical language, is called refrigerant. And this is why we call the sector refrigeration. Okay, so what to say else? So this is the same principle applied in the cold stores when storing our seasonal potatoes. It's the same system applied in the refrigerated trucks transported our yogurt and milk. The same thing in the display cabinet, in our supermarket. And the same thing in your fridge, yeah? In your air conditioning system, in data centers, and district cooling now. We are speaking district cooling, yeah? So this is a plant which provides cooling to all a city. It is very energy efficient. So this is a systematic approach that now are being much promoted. So it's vital, as I said, but it comes with a climate cost. Most of the energy goes to that component, the compressor. It uses a lot of energy. And also, in many systems now, today, they still use synthetic refrigerant, handmade refrigerant that harm the ozone layer. So we must focus on making refrigeration sustainable. The next slide, it should be coming. It's coming, okay. I'm sure you heard about it, the Montreal Protocol. We were raised with the Montreal Protocol. The IIR, the International Institute of Refrigeration, we are proud to be a historical partner of the Montreal Protocol, acting as the scientific arm to the protocol. So what it does actually, it sets out a global rule, and the Montreal Protocol is the most successful global treatment adapted to today. It was adopted in September 1987. It has received a universal ratification, all the universe. And this is a very good example to show you today that thanks to the global effort and the international cooperation and the engagement and commitment of all countries, when you come together and you believe in a cause, it succeeds. The Montreal Protocol is the most successful treaty to today. What is it doing? It's phasing out these harmful ozone-depleting substances. And these ozone-depleting substances, most of them are refrigerants. When they leak from the system, they damage and they deplete the ozone. And the ozone was doing is a protective shield damaged, which has been damaged by the ODS, and creating melanoma, other cancers, and eye cataracts. Since '87 now, all the countries were working together to phase out, stop using the CFCs and HCFCs, and we have done it. Still, there are some efforts to be done from developing countries. The Montreal Protocol has supported nations to transition away from these harmful substances while protecting the industrial development and consumer. So this is a slide to show you, I hope it's running, yeah, okay. What could have happened without the Montreal Protocol? On the left, what the world could look like without the Montreal Protocol. On the right, the path we have chosen since then. We avoided a 10-fold increase in ozone depletion by 2050. And the protocol has literally helped to protect life on Earth. Where we stand today, we have phased out up to 98% of this ozone-depleting substance. The ozone layer is on track. Now today we are coming back to the same levels we have had in 1980. By 2030, it will be saving 2 million people each year from skin cancer. That's the power of the global commitment. So we have fixed the ozone layer problem, but now there is a big challenge with the climate. As we need to recognize that today, the Paris Agreement, the 1.5 degrees Celsius scenario is out of track, unfortunately. Refrigeration accounts about 20% of the global electricity use. And under a business as usual scenario, that's going to be doubled by 2050. Air conditioning alone, and today we are experiencing the problems with the extreme heats. And the problem is not only about extreme heats, it's also about the duration of these extreme heats and the frequency of these extreme heats. It goes beyond the survival limit. So 12% of the global electricity use, is associated to air conditioning. At the same time, the new generation of refrigerant, which has been introduced to the market after the Montreal Protocol, they are generating greenhouse gas emissions. So imagine this sector contributes to about 8% of the CO2 emissions. So we urgently need to implement it as a critical infrastructure, but also improving the efficiency of our systems. Improving cold chains could cut food losses by more than a half and reduce the emissions by about 600 million tons of CO2 equivalent. So nearly 50% of the impact, of the current impact. And what is the key? So the key is the widespread access to low global warming potential refrigerants, implementation of efficient systems, especially in developing countries. Refrigeration is saving. So this is, I'm sure you feel much more comfortable now. So it is saving lives in medicine too. The liquid nitrogen is used in cryotherapy to freeze and destroy the cancer cells, especially in skin and low-risk breast cancer as well. There are some cases with low-risk breast cancer treated with the cryotherapy as well. It goes to success rates up to 99%. And this is thanks to the refrigeration. And this is still only one of the many health applications. Vaccines like polio, or Ebola, and COVID-19, we have heard a lot about it today, and I imagine yesterday as well, require ultra-low storage, sometimes down to minus 90 degrees Celsius, minus 90. And without reliable refrigeration, we risk to lost doses, and it has happened in all the countries. We have all lived this nightmare of COVID, and we have been living a shortage of vaccines. Imagine if we had a better cold chain infrastructure. We would have been saving a lot of vaccines, but also a lot of lives. Even a few minutes at room temperature can render doses unusable. And you are doctors, you know it better than me. I can tell you more about the temperature stability, but yeah. Healthcare cold chains are even more delicate than food ones. Why? Because it demands a precise and stable temperature from production to injection, from cold rooms to refrigerated transport. Every link must be secure. The global market of these solutions is growing rapidly, and the solution innovation are existing. As I said, the solutions are readable, they are there. It's only about implementing and having the willingness to implement them. Medical technologies like MRI depend on refrigeration too. Liquid helium cooled to just minus 269 degrees Celsius is what makes your imaging that you are diagnosing with high precision. This kind of extreme cooling is fundamental to our modern diagnosis. And this is my last slide to show you that. And thank you for recognizing again the fundamental role of research and development in fostering innovation. And this is, I'm showing one of our projects in Africa. This is the Sophia project, developed solar-powered vaccine storage units to remote areas like Burkina Faso and Malawi. A cold storage facility was recently installed in Leo's Hospital, equipped with 1,000-liter capacity storage for drinking water, but also using natural refrigerants to provide with refrigeration needs for vaccine storage at +5, -30, and -70 degrees Celsius in a very sustainable way. And this is, proves actually that solutions are possible even in the most challenging environments. Thank you very much.
Thank you very much, Dr. Yusra Allouche. It's very, very interesting.
I hope it was not too complicated.
Yeah. The message is well. I just want to add information. For example, I remember during COVID-19 crisis, the problem of for some countries was not procurement of vaccine, it's the storage and vaccination and the cold chain. People are not vaccinated, they have a vaccine because there is many donation, but the problem is what do you call the cold chain, but also for vaccine is the center of vaccination and all the resources.
This is a part of the chain. It's a link of the chain.
Exact. So I think we'll stop here because there is another session. And thank you very much.
Thank you so much.
Thank you.
شكرا لك. ثانك يو. شكرا الأستاذ هاشمي الوزير. نتعداو توا نمر الآن إلى آخر حصة عنا. The way forward, a dialogue on support by the quadripartite and the World Bank for One Health implementation in MENA region. Dr. Shadia Wannous is going to moderate. She's here. Thank you for joining us. And for the panelists, Dr. Rashid Bougadour, Sub-Regional Representative for North Africa at WOHA, and Dr. Gita Sethi, Advisor and Global Lead for Food Systems at the World Bank. There she is. Do you think they have presentations? No, she doesn't.
Assalamu alaikum. Good afternoon, colleagues and One Health champions. Thank you for sticking with us to the end. This is the last panel, but I can assure you it's worth it. And it's hard to stand before you between you and your lunch or the beautiful visit to the beautiful country and Sidi Boussaid. So please bear with us. So it's an honor for me to welcome you here to this critical discussion on the way forward for One Health in the MENA region. And I just take a few minutes to set the stage for this dialogue. We heard yesterday and today that we live in an era where we are witnessing and experiencing interconnected crises, where the human health, the animal health, and the environment stability are interconnected and interdependent. The One Health approach is not just a concept, it's a necessity for our survival. And that's why in the MENA region, we have to take it seriously. We have seen from the presentation over the last 2 days that we have a lot of challenges. The Food and Agriculture Organization of the UN, FAO, the UN Environmental Program, UNEP, and the World Health Organization, WHO, and the World Organization for Animal Health, WOHA. And also, we welcome the World Bank Group that those two forces, they are joining their efforts to tackle these systematic challenges at global and at regional and country level. So together, we represent both the architecture and the engine that we are here to help the countries navigate those challenges through the One Health approach. So our central questions today is how are these institutions aligning their strategies, their resources, and their experience to help the countries in MENA region transition from policies, from concepts, into actions and into building resilient systems. And what are the lessons that we can learn from the success stories that we heard over the last 2 days, and where do the gaps remain, and we have to tackle them together. So to guide us with this discussion, I am privileged to have with me today Dr. Rashid Bugdour, our sub-regional representative for North Africa for the World Organization for Animal Health, who will talk about the quadripartite regional One Health framework. I am also pleased to have with me from the World Bank, Dr. Geeta Sisi. She is the advisor and the global lead for food system at the World Bank. She will share with us also insights on the bank role in financing and facilitating One Health integration into development program. So let's start with the presentation from Dr. Rashid on the regional quadripartite One Health framework. Thank you.
Thank you, Shadia. I know that the time is short. Excellencies, esteemed quadripartite partners, distinguished colleagues and One Health champions, good afternoon. It's an honor for me to address you today, representing our organization, the World Organization of Animal Health, as sub-regional representative for North Africa, and our office is in Tunis, and speaking on behalf of the regional quadripartite for the MENA. We are here for a common purpose, to reflect on how we collectively can support One Health implementation in the MENA region, Middle East, North Africa. Not with words alone, no, but through structures, strategies, and sustained partnership. Today, I will walk you through the 3 underlying building blocks for our regional One Health quadripartite effort. 1, the regional One Health coordination mechanism. 2, the regional One Health action plan, 2025-2027. And finally, 3, the joint statement of intent. For the coordination mechanism, as you see in this slide, let me begin with the foundation, how we are organized ourselves to act. 1, the coordination mechanism, regional governance in action. The regional quadripartite One Health coordination mechanism is the governance architecture that will enable consistent, region-wide collective strategic leadership and stakeholders' engagement to combat and monitor health risks at the human-animal-environment interface. It transforms our collective intent into institutional practice. It gives structure to collaboration and makes space for shared leadership. The mechanism is composed, as you see here, of 3 operational layers. First, the regional executive committee, comprised of regional heads and directors of FAO, UNEP, WHO, and WOA. This body sets strategic direction, aligns our regional programs with global priorities, and advocates for resource mobilization and political engagement at the highest levels. Second, the coordination group, our operational nerve center. It includes One Health focal points from each quadripartite organization, serving as permanent technical secretariat. This group leads the development of joint work plans, ensures follow-up on implementation, identifies gaps and opportunities, and coordinates all technical working groups. And third, finally, a series of technical groups organized by TEMS, such as zoonosis, food safety, IMR. These include experts from across the quadripartite and beyond. Importantly, the mechanism is designed to allow for ad hoc inclusion of external stakeholders, such as regional organizations, academic institutions, etc., etc. Each entity within the mechanism has clearly defined the role and the responsibilities as outlined in the coordination document. Meetings are regular and rotating between the quadripartites. The coordination group meets monthly. The executive committees meets annually or as needed. And technical groups are yet to be established, but will convene every 2-3 months. The structure ensures continuity, accountability, and flexibility. 3 essential qualities for effective regional coordination. It also enables an element with the Global One Health Joint Plan of Action and provides a regional platform to interact with the quadripartite Global Secretariat. Moreover, each regional organization is expected to contribute human and technical resources and to actively promote One Health activities within its own programming and country engagement. The mechanism is not a parallel system. It is a collaborative platform for integration. Now we have this slide regarding the regional quadripartite One Health Action Plan 2025 and 2027, from structure to delivery. With governance in place, the next step is execution. And that's where the regional quadripartite One Health Action Plan 2025-2027 comes in. This plan was developed jointly by our regional technical teams, the coordination group, OHCG, aims at transforming vision into action. That's the challenge. To advance the One Health implementation at regional and the national level, to detect, prevent, and respond to health threats at the human-animal environment interface using the One Health approach through collaborative efforts. The regional quadripartite One Health Action Plan is fully aligned with the Global One Health Joint Plan of Action and is built on 3 interrelated outcomes and their corresponding outputs and activities. Outcome 1 is the regional One Health quadripartite. Coordination mechanism formalized and sustained. Improved coordination, communication, and alignment of One Health activities and capacity building efforts. This includes maintaining the activities of the coordination group, regular meeting of the executive committees, and the creation of staffing of the 3 technical groups. Established monitoring and evaluation tool already underway. Holding annual reporting exercises and organizing regular regional stakeholder workshops and interagency training. Outcome 2, strengthening national sectoral coordination, strengthening national cross-sectoral capacity for development of One Health mechanism and equitable multi-level work plan and strategies in line with One Health principle and the One Health joint plan of action. Supporting countries to assess their existing One Health structure, helping develop and or revise national coordination frameworks and operational plan, facilitating stakeholder mapping and legal framework analysis, and providing targeted technical support to national focal points. A strong emphasis is placed on subnational and multi-sectoral engagement, ensuring that One Health is not only a national level dialogue, but a whole of society approach. Outcome 3, improved joint practices and data integration, improving the One Health joint practices and actions at national and regional level using various tools and technology that integrate data and knowledge, enhancing surveillance, response, and prevention efforts across sectors. Promoting institutional surveillance, early warning, risk assessment, preparedness, and response to health threats, risk at human-animal environment interfaces, using digital tools and platforms such as a shared database, GIS tools, and simulation exercise to build interoperability, enhancing joint outbreak investigation protocols, and science to policy translation mechanisms. Strengthening One Health workforce capacity, it's important, in urban sectors in the member states. And finally, special focus is given to environmental health integration with UNEP leading efforts on ecosystem assessments, biodiversity, and One Health linkage and environmental capacity building. As you know, the environment UNEP is our partner, is the last partner, he signed in 2022 to transform tripartite in quadripartite. This is the regional One Health action plan, quadripartite action plan for the 3 years, 2025 and 2027. There are over 30 concrete activities sequenced across the 3-year timeline, as you know, and as you see here, with clear leads and co-leads and built-in flexibility to adapt to emerging issues. It's not, we are flexible, it's not blocked. This is a living work plan, not a static document. It's monitoring annually with adjustments based on progress and feedback. Through it, the quadripartite offers technical support, guidance, and policy tools to member states across the MENA region. This slide is for us important because it's 2nd June this year. It's the endorsement of the joint statement of commitment among the regional directors, representatives of the quadripartite. And the 4 colleagues signed this document, this engagement, in 2nd June. The joint statement of intent, it's the first time we have this joint statement of intent, is a regional pact for One Health. It's important. Allow me now to close with the joint statement of intent, which was signed here by the regional representatives of the quadripartite on 2nd June, under the theme, One Health, One Region, One String. The statement is more than symbolic. It reiterates our commitment to long-term, multi-sectoral, and cross-border cooperation. Second, affirms the importance of building resilience against human, animal, environment, health policy threats for our region. And finally, formally launch the coordination mechanism and action plan, offering a coherent, regionally tailored response and to global health risks. This document reflects not only a collective vision, but a structured operational pathway to embed the One Health approach across our region's system. They serve as both strategic guides for the future and symbols of unity, placing collaboration at the heart of prevention, preparedness, and response. They reaffirm that we, as FAO, UNEP, WHO, and WOA, are not working in parallel, but as one integrated front to support our countries in adopting, implementing, and sustaining One Health approach. In conclusion, yes, in conclusion, a few words. Excellencies, colleagues, what we have today, a joint strategy, an inclusive coordination platform, and the shared commitment puts the MENA region in a strong position to become, we start now with the actions. Yes. In strong position to become a global example of operational One Health, but implementation is the real test. We must now mobilize the resources and partner with financial institutions, like the World Bank, for example, to ensure the long-term sustainability of our efforts to support countries most in need, align national policies with these regional and global frameworks, invest in training, workforce retention, and community engagement, and most importantly, maintain political commitment through this entire journey. The path ahead will not be easy, but is essential. And we are not working it alone. Let us move from plans to action. Let us demonstrate that regional coordination can deliver concrete impact. Let us build systems that protect people, animals, and ecosystems together. Thank you.
Thank you very much, Dr. Rashid, for sharing with us the 3 key pillars of. I would like to follow up with one question with you. You talked about the whole of society approach. So how do you think this regional coordination mechanism can engage with the civil society organization, with research institutions and academia to make this link between science, communities, and policy?
Yes, thank you, Shadia, for this question. As you know, civil society and academia play a critical role on advancing One Health implementation. And the regional coordination mechanism is designed to be inclusive. As outlined in the presentation, the mechanism includes technical groups that are open to external stakeholders. It's not closed, such as NGOs and NGOs association, etc., academic institution, vet school, for example, and community-based organization. We are open. They can also participate in the stakeholders workshops and support advocacy and accountability by monitoring progress, advocating for transparency in resource allocation, and holding sectors accountable to One Health commitment. The coordination mechanism is a flexible structure, allows for ad hoc inclusion, ensuring civil society is very important. Civil society's voice is heard in both policy design and implementation. For us, One Health without civil society is incomplete. Thank you.
Thank you very much, Dr. Rashid. I now give the floor to our colleagues and partner from the World Bank, Geeta, to share her perspective on the way forward for One Health in the region.
Thank you very much. Excellencies, esteemed colleagues, friends, a pleasure to be here. Let me first start by congratulating the quadripartite for this historic pandemic treaty that really has provided the global governance as we move forward, rather we accelerate forward on the prevention using One Health as the foundation. WHO and many of our very well-known scientists have been saying relentlessly to us that we are not ready as a collective to address the next pandemic. And these 2 days have been very profound because they've really put a big dent and created a delta in terms of moving into actions on One Health. The second issue that we do know very well is no one is safe till everybody is safe. And therefore, the Carthage communique and the agreement that made it a regional initiative is also a move in the right direction. Before I say what I think are 3 big areas of focus for the region, for the MENA region, let me share a little bit our own journey in the institution. As probably some of you are aware, during the COVID-19, the World Bank invested close to 42 billion with our client countries, but it was mostly in response across the globe. And let no crisis be wasted. So we took this opportunity to really bring back the agenda of One Health as a foundation for prevention that we all have flirted with during every crisis for the past almost 3 decades, and then moved into a cycle of panic and then neglect. But I'm very pleased to say that today in the institution, thanks to many of you in this room, prevention has become core to health security, and we have a big program. During the COVID crisis, as my colleague yesterday showed, we had the flagship on investment framework for pandemic response. And that created a lot of interest and demand from countries to understand what they need to do better for future pandemics that are zoonotic in nature. And a very small amount of resources that provided this upstream evidence and analytics has led to portfolio of close to 5 billion now in Africa, in Central Asia, and in South Asia. And I'm going to use some of those reflections and learnings we have from there, plus, of course, a huge lot of knowledge in this room to give at least my view of what MENA may want to think about as we move forward. First, it is a multi-sectoral agenda to address pandemics zoonotic in nature, to prevention, particularly on the prevention side. But we don't need a Christmas tree as an investment option. We can continue, whether it's environment, whether it's agriculture and food, but put a lens of One Health and monitor and share information. I think that itself will have a huge impact. A second big learning we have from our programs is any multi-sectoral agenda, and we saw this continuously in the last 2 days, of how water insecurity, food insecurity, climate resilience, adaptation, all so very interrelated. So the One Health as a foundation for prevention is a multi-sectoral agenda. And what's quintessential to have a big impact is coordination. We've also seen that when so many line ministries are involved, usually coordination is better if it's lifted above the line ministries in the Prime Minister's office, the President's office, or some other entity that can really work very closely with members of cabinet. The third area I think that would be important for MENA is to really do a deep dive in terms of One Health expenditure framework. Now, what do I mean by that? There is no budget line item called One Health. So how does a policymaker know what to do less of and what to do more of? We are in the process of developing a methodology looking at the entire government expenditures to define what One Health expenditure, what One Health budget line means, and therefore then provide this really as a management tool to governments to see what to do more of, where the gaps are, and what kind of capacity to support. My last point to all of us here is this conversation that we've had in the 2 days has to leave this room. We are talking to the converted here. We are singing from the same hymn sheet. But there is a lack of awareness on One Health and how it's really related to all other sectors. And therefore, it's very important that we all become messengers. But it also means a very critical communications, a very strategic communications on this that's simple, that's very tangible, and that's very clear to a lot of non-technical audiences. So with that, I'll stop. I'm also very aware, and my colleague here has told me I need to be quick, sharp, and be out of here.
Thank you very much. Thank you so much for highlighting the issue of prevention. I don't think we talk enough about it. And also the importance to have One Health approach to achieve prevention. And that the World Bank is working on methodology to see how we can include the One Health budget in our national budget lines. So thank you so much for highlighting these important issues. Before we close, I would like to thank both of our speakers, and I would like to have a call to action to all of us as we leave here today to commit to translate the framework into national plans and into budgets. And the second one is to break those sectoral silos between us and use more the One Health approach to achieve more coherence, more harmonization between the sectors. And the third one is we need to monitor and evaluate our action. We need to measure the progress, and we need to communicate, as you said, Gita, communicate clear and simple messages to the policymakers, to the public, to the different audiences, to ensure that everybody understands how One Health is cost effective and how it's saving lives and livelihoods. I would like to give 1 minute to my colleague, Dr. Rashid, before we close. 30 seconds.
Thank you, Shada. I just want to thank sincerely my colleague Francesco Valentini for the work, for the engagement, for the involvement during all the for One Health and quadripartite. Sincerely, thanks. And I would like to associate Dr. Nadia Brick, our technical officer, One Health, in this job. Thank you.
Thank you, Rashid. Thank you, colleagues. Of course, it's very important to highlight this. And the last word from all of us, that we believe that in the MENA region, we have the tools. And we have now the declarations. We have also the community of practice that was just launched by the government of Tunisia. We have the partners with us. And we also have the urgency to tackle all those health crises. So let's move together and let's deliver on this agenda. Thank you so much.
And thank you, Dr. Shadia Wannas. Thank you for brilliantly moderating this session. Last but not least, One Health vision for the MENA region. Closing of the regional MENA One Health conference after 2 days. I'm pleased to announce the last but not least, Dr. Abdelrazak Bouzouita, General Director at Ministry of Health, Government of Tunisia. The floor is yours. آخر مداخلة، فمش كون يحب يقول أي حاجة. بعد ذا يوفى. شكرا معالي الوزير.
يعطيك الصحة. Oui, ça marche. Merci Wassim. يوم رائع، يوم ثاني رائع وممتاز. طلب مني كلمة الختام، ولكن هو ليس ختام، هو بداية. وإذا كان نحاولوا الوان هيلث ردوها رحلة، هو اليوم تنطلق طائرة الرحلة. سنرحل من الرؤية النظرية إلى الرؤية التطبيقية. شفنا اليوم في المداخلات كيف أن النظرية اللي شفناها البارح تطبق على الواقع بأمثلة متعددة. أمثلة متعددة تشمل 3 مجالات: صحة الإنسان، صحة البيئة، والصحة الحيوانية. الطائرة حلقت من عالم البحث إلى عالم التطبيق، وشفنا كيفاش ننطلقوا من المخابر إلى تطبيق الواقعي لحماية صحة الإنسان، ولكن حيوان سليم في بيئة سليمة. باش نختم هذا اليوم نجم نقول إذا كان نعمل مقارنة كيف يمكن أن نعرف بالوان هيلث. الوان هيلث هي كرؤية الأسرة، كرؤية الأب والأم الذين ينصحوا أطفالهم وأحفادهم بأنهم يتغذوا تغذية سليمة في بيئة سليمة لحفاظاً على صحتهم وعلى المستقبل، لأطفال في صحة جيدة، لعائلة في صحة جيدة. احنا اليوم عائلة واحدة تجمعنا مبدأ واحد، هو صحة واحدة، صحة بلا حدود في عالم سليم. شكراً على الحضور، شكراً لكم بوجودكم هذا اليوم، بوجودكم البارح اليوم، وجود معالي الوزراء من كافة البلدان. شكراً إلى المنظمات، ونطلب منكم أن نعملوا وقفة ونصفقوا على الناس الكل اللي يساهموا في نجاح هذه اليومين، وإن شاء الله نتلقاو في فرص أخرى لنحتفلوا دائما بصحة واحدة. شكرا. Thank you very much. Merci beaucoup. Grazie.
خليك بحذايا لانك انت منهم. كل شخص ساهم في التنظيم يجي هوني من غير ما نقعدوا نسميو فيكم، ما نعرفش اسامي الناس كل. اي شخص ساهم في التنظيم يجي هنا. بالله لا تعبوني، سي رياض ابدا من غير ما تعيط، مدام اسماء، الناس الكل، حتى مدام هيفا، توت لي بيرسون، خاطر مجموعه كبيره وقتها نصفقوا عليهم بالكدا. ايمن، اي شخص بالله يجاو، اي شخص ساهم في التنظيم خلي تلموا ساعه باش نعملوا صوره مع سيد الوزير، الساده الوزراء كان يسمحوا. الكل بالله، الكل بالله، باش ما تقولوش بعد نساء. انا تعرفوا اللي ما نعرفكمش الكل، كان جاي ثرسي عبد الرزاق شعايد تقولوا انا ما نعرفش الناس الكل. Yes, I will say it in English and French. Every person who helped in organizing these 2 days, please join us on stage. I won't call you by name. Any person who helped even a minute, please join us on stage. Toutes les personnes qui ont contribué à l'organisation, ne serait-ce que par une idée ou même quelques minutes, veuillez nous rejoindre sur cette scène, s'il vous plaît. Voilà. Voilà. حاب نتاكد الناس كل هوني، ها نعرف زي ما فما شكون يحشموا، ان شاء الله ما نسينا حد. اي شخص الكل. toute l'équipe Evancia زاده. برافو ايفانسيا pour l'organisation vraiment. شفت حتى ليكيب تاع لي انتربريت كل اي شخص راهو ساهم هوني مرحبا به. او ما لي انتربريت يقولوا ما عاد عندكم ما ترجموا سي جاو بحذينا. اي شخص راهو كل نجاحكم، هما ما فهمونا الا بخدمتكم انتوما. راهو ليكيب دي انتربريت بالله يجاو الناس كل. اي شخص ساهم.
بربي تصفيق كبير على وسيم بالعربي.
شرف لي، هذا البلادي تفاخري بالمنطقه. دونك الناس الكل بيان سور الا لي فوتوغراف مش ينجموا بهم، هما باش يصوروا. مي تحيه ليهم. جي في ليكيب دو في اي بي سيرفيس، الناس الكل تعرف سي بيان دو اوي دو سيكلوب. يعني باش تفهموا اللي هما جنود خفاء، السين تعبات والقاعه ما فرختش، يعني الكلهم جاوا من اماكن اخرى، كلهم اللي في الكابين داتابريت، اللي كانوا لبرا، اللي تلقاهم التالي. تحيه سي فوزي، توت لي زيكيب، سي رياض غاديك هذوكم ما ينجموش يسيبونا، ما كانش الكرون يطفى والصوت يقص تحيه ليهم فريمون الكل. فوالا سون جي سالوي فانسيا دونك تهز الكل. دكتور سينا العسكرية أيضا برافو. شكرا معالي الوزير مصطفى فرجاني، توت ليكيب اللي معاه. فريمون ندوة على أعلى مستوى.